2, 2, 2, 2, 10. 2, 10. 2, 10. 10, 2, 10. 10, 2, 10.
Merge, facem o probă să vedem cum se aude bine până în spate. Salutare tuturor, altă probă n-avem nevoie, mersi. Bun. Încet, încet e vremea să pornim. Doamnelor, domnișoarelor, domnilor, bine ați revenit la Cluj, cei care sunteți pentru a doua oară, bine ați venit cei care sunteți pentru prima dată. Înainte să continui informația, I will make a short announcement in English as well. I'd like to welcome all our guests that travel all over Europe to be with us today at the 11th conference. We still have people arriving due to traffic, which is okay. The first 30 minutes are for presentation, so it's okay if they arrive. I will switch now to Romanian și voi vorbi suficient de încet încât colegele și prietenele mele de la interpretare să poată ține pasul cu mine. Vă mulțumesc foarte mult. Doamnelor, domnilor, distinși invitați, numele meu este Bob Rădulescu, gazda pentru a doua oară acestui eveniment de suflet pentru mare parte din comunitatea clujană. Vă mulțumesc că ați venit. Din rațiuni organizatorice, știind că ne așteaptă 2 zile și sâmbătă 3 zile pline, vom încerca să fim cât se poate de eficienți cu partea de prezentare, de introducere. Cred că este mult mai important pentru toată lumea conținutul informațiilor pe care le primiți decât partea de tranziție. În fiecare mapă pe care ați primit-o aveți toate informațiile de care aveți nevoie în acest moment. Orice aveți nevoie în plus, sper din suflet să vi se răspundă la sesiunea de Q&A, sesiune de întrebări și răspunsuri pe care o avem după fiecare calup de speaker care vor urca pe această scenă. Spre deosebire de evenimentul de anul trecut, când unii dintre voi ați fost aici, anul acesta avem și fotoliile pe scenă, unii dintre invitați vor fi pe scenă în timp ce alt invitat are partea de prezentare. În rest, avem coffee break, ne vedem la cină și, repet, suntem alături, doamnelor, domnilor, astăzi, mâine și mai bine de jumătate din ziua de sâmbătă. Trec un pic la pupitru ca să pot face niște anunțuri mai oficiale și să nu greșesc cu nimic. Așadar, CF Europe, cred că toată lumea cunoaște și dacă sunteți aici înseamnă că sunteți conectați direct într-o formă sau alta cu CF. Așadar, CF Europe, European Cystic Fibrosis Society, Asociația de Fibroză Chistică din România și Asociația Împreună pentru Patrick se numără printre organizatori. Fac o scurtă pauză tot tehnic să vă spun că avem în spate colegii de la pupitru de interpretare au, cred, căști pentru majoritatea. Foarte multe prezentări vor fi în limba română, multe vor fi în limba engleză. Dacă aveți nevoie de precizie și exactitate ca să înțelegeți mai bine, vă rog foarte mult, fie că sunteți vorbitori de limba română, fie nu, puteți să luați căști și să vă asigurați că toate informațiile care vor fi discutate pe această scenă sunt înțelese de toată lumea. Vă puteți lua liniștiți căști, canalul 1 limba română, canalul 2 limba engleză. Și puteți înțelege, dacă e în limba engleză, să aveți traducere în română la căști, dacă e invers să vă descurcați. Asta e foarte important de menționat, ca să fiți siguri că obțineți informațiile și traducerea exactă. De asemenea, aș vrea să mulțumesc foarte mult pentru această a 11-a ediție. E posibilă odată prin prezența și implicarea dumneavoastră a tuturor celor prezenți. Avem parteneri și prieteni și sponsori pe care îi aveți inclusiv în broșura care este în dosarul fiecăruia dintre dumneavoastră, dar e frumos și vreau neapărat să-i amintesc. Mulțumim nevertebrate.ro, Vertex, Davagio, Sapaco 2000, Cystic Fibrosis Foundation, Boehringer Ingelheim, Duc Farm, Nutrigenetics, Mama Manu, NIM Global Logistic, Carpental, Daisler Print House, Zano. Nu în ultimul rând, mulțumim frumos Primăriei și Consiliului Local Cluj-Napoca pentru sprijin. În agenda despre care v-am spus aveți și orarul detaliat pe zile și înainte să trecem la el, mi-aș dori foarte mult în deschidere, fiind vorba de o conferință care cuprinde partea de sud-est a Europei, să invit câțiva oaspeți de seamă să ne spună câteva cuvinte. Așadar, aș vrea să încep cu doamna Hilde de Keyser, din partea CFI, for superior și în poziția dânsei de CEO, o invit alături de noi să ne spună câteva cuvinte de bun venit. În aplauzele dumneavoastră, Hilde de Keyser, mulțumim foarte mult! Thank you so much. Welcome. We'll make sure this doesn't stop.
Hello, everybody. It is an honor and a pleasure to be here and to be able to open the 11th Southeastern European CF Conference in Cluj. It is of high importance that we are able to be here with all stakeholders, people with CF, their families, their healthcare professionals, and all people involved, to look at the situation of CF care and together try and move it forward to make sure that all people with CF have access to optimal care across Europe, in Cluj, in Romania, in Eastern and Western Europe. Together, we can make a difference. We can make sure that people with CF can live their life to the fullest potential and that we leave no one behind. I am very much looking forward to these 3 days to learn, to share, to network, and to do that together with you. Thank you very much.
Mulțumim foarte frumos, thank you kindly. Continuăm.
Mulțumim.
Dreviniec din partea European Cystic Fibrosis Society. Hello, welcome.
Bun venit. Mulțumim, dragi colegi. Este o onoare pentru mine să mă aflu aici și
Half of the European Cystic Fibrosis Society. Cystic Fibrosis Society aims at improving the quality of care for cystic fibrosis patients across Europe, and I can assure you that it's of great interest to the society to support Eastern European countries and Eastern European CF centers. That's also the reason why the society fully supports the twinning program, the twinning project, where we want to support the Eastern European members and countries. This is the 11th Southeastern European Conference, and I understand that this is already the tradition of the CF Europe to organize such conferences. But for the first time, this conference is also very dedicated to the twinning program. And I'm very happy that the hosting country is Romania, which is part of the twinning program. So I thank you very much to the local organizers, to OANA for organizing such a great event. I hope that you find the meeting very useful and find it as the opportunity for further networking, and it will be for all of us very enjoyable time. Enjoy.
Mr. Pavel Drevinic, thank you so much, mulțumim foarte mult. Continuăm cu domnul profesor dr. Liviu Pop, venit tocmai de la Timișoara pentru a doua oară alături de noi la acest eveniment, care ne va spune și domnia sa câteva cuvinte de bun venit. Domnule profesor doctor, bine ați venit!
Bine v-am reîntâlnit, bună ziua! Sunt bucuros să mă aflu aici. Este un moment important, cum spuneam și la conferința de presă, fibroza chistică este o boală complexă care implică, pe de o parte, aspectul de intervenție a profesioniștilor cu acele grupuri multidisciplinare și, pe de altă parte, aspectul medico-social de susținere. Este o boală
support aspect. So it's a very complex disease. The fact that today we're here together in Cluj, professionals, parents of children with cystic fibrosis, under the aegis of CFE, is something special. And I believe, I hope, that following this conference we'll have very good outcomes, and hopefully we'll be able to advance in this permanently acute issue of cystic fibrosis, at least here in Romania. Thank you.
Mulțumim frumos, domnule profesor.
Thank you, Professor Liviu Pop.
Tot ca și anul trecut, avem ca și garant
Again, for the second time,
din partea ambasadorului
here in Cluj from the Embassy of the US in Bucharest. Welcome, Mrs. Monica Bogodai. I welcome her on stage. I will try to help everyone here with this step because it's a bit more difficult. Good day, everyone. Please allow me to convey the embassy's message in English.
Ladies and gentlemen, it is a real pleasure and honor to be here and speak on behalf of the US Embassy at this year's session of the Cystic Fibrosis Southeastern European Conference. I am excited to be part of this ongoing journey toward better treatments and care for those affected by cystic fibrosis. Congratulations to the organizer, firstly, of course, for selecting Romania and Cluj, and then for bringing together such a diverse group of people, from government officials to medical specialists to patients and their families, from Romania and beyond. It's truly inspiring to see so many people united in this cause. At the US Department of Commerce, in the US Embassy, we aim to connect US companies who are often at the forefront of healthcare innovation with decision makers here in Romania. It's all about finding the right solutions to help improve people's lives. And we're excited to play a role in this process. From large and well-known companies such as GE, Medtronic, Pfizer, AbbVie, to the ones that bring breakthrough solutions like Vertex, we are proud to facilitate the delivery of their innovative technologies and medicines to Romania. Now, while there's still no cure for cystic fibrosis, we're closer than ever to make it a manageable, livable condition. That's something to be hopeful about, and this conference is proof of the incredible progress that has been made. It is a reminder that by working together across industries, borders, and disciplines, we can make a real difference. I wish you all the best as you continue on this journey, and please do not hesitate to reach out to us. We are here to support you, and I look forward to what we can achieve together. Thank you.
Din partea Ambasadei Statelor
On behalf of the US Embassy, once again, thank you, Mrs. Monica Bogodai. And now we come back to another physician who comes all the way from Bucharest to join us for the 11th conference, Dr. Simona Mușescu. Welcome. Please tell us a few welcoming words. I will try to be we'll try to be your knight here and help you. Hello, everyone. I'm happy to be here. Thank you for inviting me. I'm happy to see older faces, new faces, guests from abroad, patients, dear partners who are together with us in the twinning project. I'm really happy that all these have a very clear outcome, and it already bears fruit, which is an exchange of experience between medical staff and between patients from European countries. I really hope that these few days of conference will bring you new and useful information, interesting information that will help make our lives better. As physicians, we will surely find out new avenues, and for sure all this information will be useful to you. All the best of luck to you.
Îi mulțumim frumos, doamnei dr.
Thank you very
Mușescu.
much, Dr. Mușescu.
Sunt de acord cu urarea dânsei
I
când
agree
spunea să vă fie
with her when
de
she
folos
says,
această întâlnire,
may
aceste două
this
zile,
meeting be
să obțineți
useful.
informații.
May you
Îmi
get
amintesc
useful
conferința
information.
de
I
anul
remember
trecut,
last
prima
year's
conferință pe
conference,
care am
which
avut
was the
bucuria să
first
prezint.
conference
N-ai
I had
știut
the honor to
absolut nimic
present.
despre FC,
I knew
despre
absolute
fibroza
nothing about
cistică
cystic
și la un
fibrosis at
moment
the
dat,
time. And at some
Povestea celor
point, there was a
65 de
story of the
trandafiri,
65
roses,
roses.
este povestea cu care eu am
That
rămas,
story is the one that
de
stuck
anul
with
trecut
me
și am
from
învățat
last
mai
year.
multe despre asta
I
prin
learned
prisma
much more
poveștii
about
care
cystic
spune că unul
fibrosis
dintre
due
copii nu
to
putea
this
să
story, the
pronunțe,
story that says that one of the children was unable to pronounce cystic fibrosis.
și înțelegea
What
65 roses.
what he understood
Și la un
was
moment dat
65
afirma
roses.
undeva că am boala aia cu so do I have that
At some
65
point, he
roses?
was asking himself, do I have the
What is that?
65
What do I have,
roses
ma'am?
disease?
65 roses. Și undeva în folclorul urban a rămas
Somewhere,
exact această poveste a boala celor
this story
65 de
stuck
trandafiri, evident, nu
of
se
the
poate
65
traduce
roses
decât în
disease,
limba
which
engleză.
cannot be translated
So
into
it's,
Romanian.
65 roses pe care eu le-am ținut minte de anul trecut și apropo de
So
ce
the
spunea
65
doamna
roses
doctor,
stuck with
să vă
me.
fie aceste 3 zile
So
pline
may
de
these 3 days, as Dr. Moșescu was saying, be useful to you, so that you can take all this information back to your communities. I'm referring to the physicians present here, but I'm referring to the parents present here as well. Oana, Miki, Patrick, and everyone else. I believe that parents try as hard as they can, as hard as physicians, in order to be able to come up with better solutions for better lives for their children. So, ladies and gentlemen, this is my wish for you. May these 3 days be days where you receive the necessary pathways and the necessary information that will help you, starting tomorrow or the day after tomorrow, make life better and slightly easier. Thank you very much. According to the agenda, we'll start the first panel. As I was saying earlier, for the first time, the setup is slightly different. You can see some chairs here on stage. Part of the guests will be sitting on these chairs all throughout the panels. So for our first panel that will last until 3 o'clock, when we have a Q&A session, I will ask part of our guests to come here on stage. And then Dr. Pavel Drevinek will be the first to have a presentation. So, Hilde de Keyser, please take a seat here on stage. Professor Pavel Drevinek and Georgiana Nitsu, thank you for being here. Thank you. You can look at the agenda to follow things. Our first guest here, twinning project from 2020 until today, representing ECF as standards of care from the Czech Republic, from Prague, Professor Pavel Drevinek. Thank you, Professor.
It's very comfortable. Yeah. Okay. Dear colleagues, dear friends, let's begin the conference with the first talk and the topic of the twinning. I've already mentioned several times the term twinning program or twinning project, so let me introduce it and summarize the history of the twinning program. So, according to my memories, it all began some 10 years ago during the conference meeting on the standards of care. It took place in Verona, and the outcome of the meeting were 3 publications on the standards of care. 2 of them were dedicated to the best practices, to the quality of care measurements. The 3rd publication was about the framework of cystic fibrosis centers, about their infrastructure, and I witnessed the very vivid debate. What are the standards in Europe that can be actually achieved by every single cystic fibrosis center? The leader of the Standards of Care working group at the time, Professor Carlo Castellani, stated that the standards has to set the bar, but the bar has to be achievable by the care of cystic fibrosis centers. And at the time, everyone already appreciated that some of the countries, those less economically advantaged, can perceive those standards as a big challenge. So, and it's already in the publication, we concluded that it might be a big challenge to those centers, and the improvement of standards shall be done on the gradual platform, that the immediate implementation of the guidelines of these standards may be very difficult for such countries. And the likely reason for this is the absence of the funding in those countries, the lack of staff, and also the lack of political prioritization. The follow-up survey focusing on Eastern Europe just proved that. We had a questionnaire, and the questionnaire was completed by essentially all Eastern European countries, 16 countries, as you can see on the map. And when we asked specifically about the infrastructure of the CF care, we found out that 4 countries out of 16 didn't have any centralized cystic fibrosis care. And within those 12 remaining countries, when we focus on the composition of the multidisciplinary team, we could see that it was far from the standards, from the ideal world. And strikingly, in 4 countries out of those 12, where was sort of centralized care, were no specialized CF nurses. The conclusion of this paper was that there is a need for support of the healthcare workers in Eastern Europe in terms of training and ongoing professional development. There is another chapter of the beginnings of the twinning program, and that's the clinical trial network. This is the initiative of the European Cystic Fibrosis Society, where some of the mostly Western European CF centers are part of the initiative to run clinical trials. But it's not only about clinical trials, because these centers fulfill a set of criteria, such as the number of patients being in care of in those centers. They've got adequate multidisciplinary team, and they've got the experience in clinical trials and also in delivering the very high standard to cystic fibrosis. And why I put the clinical trials network in this topic, in this theme? Because in 2019, Professor Cors van der Aand, sitting next to me during the CTN meeting, just whispered how we can help Eastern Europe, we as the CTN. So I replied, yes, let's think about it. And that was actually the birth of the twinning project. The ECFS board fully supported the idea of the twinning, and in 2020 launched, in cooperation with the CF Europe, the twinning program. What is twinning program? This is about the long-term partnership between 2 centers. One of the centers has got the role of the coach, of the trainer, of the mentor, and those centers are recruited from the clinical trials network. The other center is the center which we call mentee or trainee. So this center is from the Eastern European part, and it's like a student which can be led by their mentor. There are the goals very wide, because every single mentee center has got different unmet needs. So it's up to the partnership, up to the twin, to find, to identify these unmet needs and to help to solve them. And the basis for the successful twinning is the meetings, is to visit each other and to become real friends. In December 2020, we awarded 9 mentees to become, or 9 CF centers to become mentees, to be part of the twinning, and they were linked to 8 mentors. as you can see on the map. The yellow dots are those for the mentee CF centers, and the blue ones are the mentors. When we ask the mentees what are their needs, they specified at the application form some of them, and you can read them, and this is something that we can anticipate. It's the lack of infrastructure, the MDT team not functional because there are no members in the team, but there is also the need for some expertise like the microbiological testing or the genetic testing or the other parts like the monitoring of nutritional status. 2020 was not the best year to launch the twinning program because we all remember the reasons why there were restrictions for traveling. So the key part of the twinning couldn't be actually realized. The people couldn't travel. So the only modes for communication were left to the online meetings, emailing, video conferences. And in 2022, in the second half of that year, there were first attempts, and very successful ones, of the on-site visits. So we were very happy to hear that the Leuven CF team visited Bucharest, CF team, Southampton visited Athens, and in 2023, Brussels team visited the host town Cluj-Napoca, and Cambridge visited Skopje. In 2024, we opened another call for the twinning, and you can see what happened. Many applications, many CF centers from Eastern Europe were interested in the twinning. So actually in 2024, we awarded 21 mentees and linked them to 19 mentors. So altogether, the twinning right now is the project for 27 twins, which comes from 25 different countries. We call this second round twinning expansion project, and it's a real expansion, a huge expansion. This expansion part of the twinning, I can say it's more professional than the pilot study, because we've got also the grant support from the American Cystic Fibrosis Foundation. And thanks to this support, we've got the project ambassador, the person who is like a liaison officer to the mentees sites. Katarina Stepankova, I'm sure that you all know her. She's done a marvelous job by visiting those Eastern European centers. This year she visited already some of them, and in previous years she visited many Ukrainian sites and also organized Eastern European meetings. So we've got the project ambassador. Another new feature of the twinning is the support of education. We've got translation services budget, and we've got the working group within the European Cystic Fibrosis Society led by Chris Smith, who is doing absolutely marvelous part of the project by disseminating the educational material to Eastern European sites, translating them into local languages and providing them. And you will hear more about this initiative tomorrow. The twinning is, of course, mostly about networking between CF centers, mentors and mentees, but also between patient organizations of the mentor and mentee countries. We've got the twinning team, and the twinning team is trying to facilitate the networking. We've organized the Zoom meetings at the beginning of this twinning expansion project. We promoted and we helped to meet or to make the meetings between the mentor and mentees during the European CF conference in Glasgow earlier this year. Southeastern European Conference is another opportunity to meet, and we are present at various local conferences like in September in Riga. But there is also the networking which has to be organized by the twinning pairs, organized by you if you are the part of the twinning. So we encourage you to go and to visit the site. to have meetings online, to organize the video conferences and emails. And we are very curious to hear about the outcomes. There will be the progress report, which will ask the twinning pairs about the success of the twinning. And we would like to hear about those visits, about the other modes of communication, about the level of involvement of other team members. Twinning is definitely not about just twinning between two doctors, the leaders of the CF centers, but about the whole team. And about the achievement of 3 main goals which were identified during the application process. So in conclusion, I would like to highlight that the twinning program is here. It's been running since 2020, and we are very happy to hear that many meetings already took place, or many other are in preparation. There is the twinning team, and it's here to help and support the twinning pairs with the travel budget, with the educational materials, and with the assistance. And for the mentee side, there is a mentor. There is a mentor, but it's mostly the friend, the closest friend on the CF level who can help you with any CF-related troubles. I would like, at the end of my presentation, thank to the Cystic Fibrosis Foundation for their support, and also to the projects within the European CF Society which contributes to the twinning, such as the European Patient Registry, the Working Group on Education, and the Clinical Trials Network. And I thank you for your attention. All right, okay. So there is no time for questions.
It's okay. Thank you, Professor Dreviniek. Yes, your intuition was right. We're about to make the next step, and I will project and the input of patient organization. Yeah, I pot să le folosesc amândouă, nu m-am gândit la asta. E ok. Așadar, pentru următorul moment, for the next moment, Hilde de Keyser, thank you, mulțumim frumos, vă rog.
Thank you very much. So, the Twinning Expansion project that Pavel started to introduce to you, it takes 2 sides to build a bridge. And I think we shouldn't forget how lucky we are in the CF community that there's all these stakeholders that do talk to each other, do want to work together, are very, very motivated to make this work together. And that is how the Twinning project started, and that is how the Twinning project entered a new phase in 2023, when, as Pavel said, CF Europe applied for a grant and received a grant from CFF that made it possible to expand the project and to come to give it a new dynamic. CF Europe is the federation of patient organizations across Europe. We have members across Europe, and the Twinning project is one of the important projects that we are working on at the moment, strengthening the CF community in Europe. We have always believed and do believe enormously in stakeholder collaboration and in patient-driven working together. And this is a very nice graph of how it works in many places and how we think it works best, and how the Twinning project also came to its next level, where patients and their caregivers, their families, are part of the conversation, are part of the solution, are part of how we face the challenges that we face in CF care, but also in the Twinning project. So, I'm sorry, Pavel, the graphs are too beautiful not to show them, so I have them in my slides as well. When we worked together between 2020 and 2023, there were challenges, as there was, of course, the pandemic, but we also saw that there were other challenges to bring CF centers and CF patients together, that it wasn't very evident to reach certain countries, certain centers. And as patient organizations, we wanted to be part of that, of the solution to that challenge. And that's how Katharina, indeed, and the team started to work with the countries of Eastern Europe and to try and bring them on board for the project. And as Pavel already showed you, that worked. The difference between the number of twins in the first call and in the second call is very visible on this map. And that is thanks to the fact that we could work more closely and more intensively together through the patient community and the scientific community together. It's very beautiful to see this. It's very beautiful to see that this is the time that we can really reach people across Europe, and we can really move forward and leave no one behind and improve the lives of people with CF across the continent. What do patient organizations bring to a project like this? Well, unmet needs. Pavel showed what the unmet needs were for the CF centers, but if you look at the life of a person with CF, there are unmet needs that are different from what the centers are reporting, and that's what we looked into in the last months and year, to make sure that the lived experience of somebody with CF could be looked at in a more complete manner, in a more complete way, to make sure that people's voices are heard within the project. We connect participating CF patient organizations to learning resources that exist. As we do on the professional level, we also do this with patient organizations. There's so many resources that are available through patient organizations in the western part of Europe, and there will be colleagues talking about that. These things are available. We will try to translate, to unlock them to those that need them most, and that can make a big difference in countries where the resources are more scarce. As for the CF centers, also for the patient organizations, we facilitate knowledge sharing and networking opportunities. It is incredibly important for people to be able to meet, learn from each other, share their experiences. But there's more than that. Patient organizations are really important in advocacy and in fundraising, and that are also topics that we will discuss, and we do discuss, between patient organizations and within patient organizations, to empower our members, the national patient organizations, to work with you on that, and to work together on that, and to do their share in moving CF care to the next level. I have touched upon this, and other people as well, that identifying the unmet needs of CF centers, patient organizations, and patients. If we do that, we can have a good view on what it means to live with CF and what is most needed for people to live well. The next step for patient organizations, just as for CF centers, is to meet, to twin, to talk to each other, to learn and work together. And I know many people are doing that already, and this conference is also an opportunity to continue doing that, to share and to meet and to learn. So that is very exciting, and I'm very much looking forward to the conversations that will take place in the coming days. Connecting the CF community to learning resources. So CF Europe will make sure that the patient organizations that are in the twinning project do have access to resources that exist, and we will make sure that that gets widespread, and that patient organizations will have the tools they need as much as we possibly can to grow and to get stronger and to do the work that they so badly want to do, but sometimes don't have the resources for. facilitate knowledge sharing and networking opportunities. I already said that, between CF centers and POs, patient organizations, that is, between patient organizations amongst them. That's incredibly important. If I is replaced by we, even illness becomes wellness. I so much believe that we need to do this together, and we can do this together. And that if we use opportunities like this to share and bring up ideas and learn from each other, we can make a difference in many lives of people with CF and their loved ones. There is not so much new in this. Pavel has said a lot of these things. Maybe one thing, this conference next time will be held in Kosovo. Pavel talked about Katarina's work, so I don't need to repeat that. So that brings me to the end of my presentation. Thank you very much.
Hilde de Keisel, thank you so much. Mergem mai departe, mulțumim frumos.
Moving on. Mărturii și care este realitatea proiectului de înfrățire. For the next two panels, we'll have two teams. I will invite here on stage Elke de Wachter from Brussels, Belgium, and Cilo Enico Sabo from Cluj-Napoca, Romania. Please give them a round of applause. Elke and Cilo, welcome.
Hello everyone, I'm Elke de Wachter. I'm a pediatric pulmonologist at the University Hospital in Brussels, and this is my colleague in Romania, and we got to know each other thanks to the Twinning Project. So we are doing a dual talk, and the aim of our talk is to share our experience on the Twinning Project. So we go over this because you know about that. The Twinning Project is aiming to bring people together, bringing a mentor side together with the mentee side. I'm the doctor from the mentor side, and Cilo Sabo is a doctor of the mentee side. And we would like to go through our CF journey together. Everything started in December 2020 when we received the results of becoming connected to the center of Cluj. And I will go with you through the rest of our journey, first from UZ Brussels point of view, and then Cilo will share her experiences. So the very first thing we did when we received this information is to find out where Cluj is. Shame on us, we even were not aware where Cluj-Napoca was sited. It's a lovely big city. The next thing was that we decided to do online meetings because we were familiar to that, thanks to COVID. However, we faced some barriers. There were connection problems. We had to postpone a meeting because of an emergency in the clinic. There was a language barrier. So to be honest, the very first meetings were exploratory. There was a certain shyness towards each other, and that was difficult to break due to the virtual character of the encounter. But little by little, we got to know each other better, and we found out that we just differ one day. We share almost birthdays. So there was a link, there was a big link. So next, we had more online meetings. They were always with Cilo. And what we found out is that the huge language barrier, little by little, improved because she took language education. She did courses. So it made it much easier to communicate together. We had meetings with different members of our team, the psychologist, the physiotherapist, our CF nurse. We discussed standards of care papers and tried to identify barriers, and mainly that was a multidisciplinary approach, a multidisciplinary team. And we really planned to go on site and to plan each other in person. But there were some co-founders, there were other things to tackle. We had still COVID. There was problems with the war. So we had to postpone our visit, and eventually we visited the Cluj Center last year in May. We were able to give some presentations and do a scientific part, but we also were glad to to be invited at the outpatient clinic, at the hospitalization unit, and to identify some unmet needs. And we were lucky to bring our physiotherapist and our CF nurse from the center together with me. And one of these unmet needs was the lack of a physiotherapist. So we were able, just with small changes, small advices, to make a difference in physiotherapy in people with CF. We were able to have a look at the sweat test facilities in the center of Cluj and to discuss the pitfalls of conductivity measurements. And so we were very glad to see each other 1 month later at this ECFS conference during the hands-on session, training with the Macroduct Advanced system. So what we learned as a mentor site is that trust and a personal match is the best basis for further collaboration and to support each other when needed and where needed. That the ideal world, even at our center, is often far away, but it opens your perspective and it can lead to very interesting and alternative ways to achieve your goal. And one of the most important things that I saw here is dedication. Dedication is valuable, precious. Even if the ideal world is far away, dedication can be a very strong driving force to make the impossible things possible. And that's what we not only saw in a doctor, but also in patients, in parents of patients. They have a real dedicated team together, and I believe they can make wonderful things. So I give the word to Cilla.
Thank you very much. Yes, thank you. And I want to show you our experience. And in 2020, I make an application for the project. And after that, I received the acceptance. And after that, we have some meetings on Microsoft Teams meeting. The first meeting to get to know the teams. And after that, we're sharing the organizational structure of the departments and discussing difficult cases. And the same is sharing the improvement of communication with parents and patients, and the same learning the new physical therapy techniques. After that, our mentor team come in Cluj, and we have the educational part, and the same. After that, we have together activities and collaborations. And I give the continue. Okay.
So our long-term visions, our long-term plans are to closely keep in contact with each other. Especially we need to invite people from Cluj to our center, but we had our problems too in our center, so therefore we were not able to invite people from Cluj this summertime, but we will definitely achieve in that. We will continue on discussing difficult cases and continue on building a strong CF network also outside our hospital and our village or our city. And the plan is to strengthen our collaboration, to define new future collaborations like scientific projects, like other things to tackle. So many plans. Thank you.
Thank you so much. Mulțumim foarte frumos. Köszönöm szépen.
So we had Elke de Wachter and Cilla Enikő Szabo with testimonials. For our next testimonial session, I will invite Mieke Bon from Leuven in Belgium and Dr. Simona Moșescu from Bucharest, Romania. Thank you.
Hello, good afternoon. So my name is Mieke Bon. I'm a pediatric pulmonologist working in the CF Center in Leuven in Belgium. And together with Simona, I will talk a little bit about our experience, and it will be a bit similar to what Elke told, but we did it in a bit similar way. So back in 2020, we applied to become a mentor because we thought this is a very valuable project to win with the center in the eastern part of Europe. And so we applied, as well as Simona Center applied, and we got selected as one of the first twinning pairs that got started. Of course, the CF Center in Bucharest tried to set some goals, and the main goals we defined together were to build up a partnership, to work in a CF team, and this was really one of the most important goals for them, because they didn't have a real CF team with a lot of other multidisciplinary caregivers. They wanted to learn about managing severe respiratory cases, and they also wanted to become a CF clinical trial site. But of course, just after we got selected to become a mentor and mentee team, the COVID pandemic came within, and we had to try to find a solution for that. So we as well, we started with some online meetings, and in the beginning we thought, well, we'll just meet, we'll try to get to know each other, and we'll try to see what we can do with these online meetings. And actually, from January 2021, we organized 9 online meetings. In the first place, to define the priority goals, and actually one of the most important goals for Simona was to set up a multidisciplinary CF team in Bucharest to have some advice on severe cases. And then she also attended one of our multidisciplinary team meetings in Leuven through an online Zoom meeting, which was actually quite interesting for them to see and to learn how we discuss patients, how we organize our multidisciplinary care teams. We also had some online meetings on difficult cases, on difficult infections. We had a specific online meeting on nutrition, which was also a very important topic because this was a little bit underestimated in Bucharest. We had a session on diabetes, on the use of modulators, because approximately at the same time in Belgium and in Bucharest, we were able to introduce the use of Kaftrio, which was really, really interesting. We had a session on bronchoscopy and a session with our hepatologist on CF liver disease. We were also able to organize some online physiotherapy sessions, which were really challenging, but Miriam, our physiotherapist, she did really, really well. And so in Bucharest, we had a patient, a mother, a physiotherapist, and a doctor, as you can see on the pictures there. And so in Leuven, we had Miriam, our physiotherapist, and she instructed the mother and the physiotherapist how to organize the physiotherapy in a CF patient and what the important techniques could be to improve the physiotherapy. We also had a meeting with Trudy, our psychologist, with her colleague in Bucharest about supporting newly diagnosed cases with cystic fibrosis and on how to support the patients with their severe disease. And so this was the start. We had these online meetings, and in this way we got to know each other, and of course we wanted to go and visit the center in Bucharest. And in November 2022, I, as a pediatric doctor, went together with one of our physiotherapists to Bucharest for a visit of 3 days. And what we did there was a lot of education. We gave some medical education, some medical instruction, some physiotherapy training, some real live sessions with physiotherapy, with the physiotherapists from the hospital, with the patients, with the parents, and we really tried to give them very specific individual instructions. So we wanted and we tried to focus on self-treatment because physiotherapy care in a home setting in Romania seems to be a very big challenge and a very big problem. And then from the other side, Livia, one of the young pediatric pulmonologists from Bucharest, came to our center in April 2023 to see how we work, to see and learn about how we organize our multidisciplinary care meetings, how we organize the outpatient and inpatient clinics, and we tried to give her some bedside teaching on cystic fibrosis and on some other respiratory diseases. There were again addressed several specific topics during our multidisciplinary care teams on physiotherapy, on nutrition, on psychological support, social support for the patients. The nursing aspects of CF care were explained. Lung function tests were hands-on trained, and also some topics on CF research, because we are a CTN site, we do a lot of clinical trials in CF, and we also showed her how we organize this. We had some discussions on cases, some cases from our side, some cases from their side, and I think she had a very interesting and lovely stay in our center. And then, of course, we wanted to spread the word. We wanted to talk about our experience, and we had a poster presentation on our twinning experience and how we organized it during the pandemic and tried to do something useful with online meetings. For me, the conclusions from our twinning experience were that actually in Romania there's no big gaps in medical treatment. They have CFTR modulator treatment, very similar to the Belgian situation. We identified some main gaps in the organization of multidisciplinary teams. We tried to do some specific training in physiotherapy, tried to really instruct the patients and the parents. A focus is needed on nutrition, and we really learned and experienced that organization of healthcare really has an impact on how you can work as a doctor, as a team, how you can organize care for these patients. I think we agree, Simona, that the way forward is hard work and dedication, and scientific training and education is really important to make these steps forward. So a few pictures of our meetings together, and I would like to conclude saying that twinning is really winning, because also for us, working in a Western center with a lot of possibilities, we've learned a lot by visiting the center in Bucharest, by having Livia in our center, and to see and learn from each other.
Okay, thank you, Mike. I'll try to speak in English for my colleague, for Mike. She was in Bucharest for 3 days, and with the physiotherapist, with Miriam, just work side by side with us, 2 days, I think 10 hours every day, also in clinical cases and also in physiotherapy. I think around 16 patients were in physiotherapy there with Miriam, aside with our physiotherapists. And every meeting, every month's meeting, online meeting, because the COVID was then, was like oxygen breathing for me and for my colleague, because they show us how much is and how important is hard working and dedication. This I think there are the first qualities that a center should have. And every member should have this feeling. If we have this, perhaps we'll have a very good work with our patients. We don't have such a good multidisciplinary team in our hospital. We have just physiotherapists and psychologists and 2 pediatricians. But with all of this and with the support from people that came from outside and teach us about the importance of physiotherapy, especially physiotherapy that is lacking in Romania. I think it is a very, very good forward step for us and for our patients, I think. And thank you, Mike, and all your team. It was a very nice experience, and I hope we'll be together from now on again.
Absolutely. Thank you.
Să urci și să cobori pe scenă e o chestiune de...
Getting on stage and off stage is the stretching exercise that's very healthy, but I really want to make sure that everyone is safe at the same time. Thank you very much, Mike Bun. Thank you, Dr. Simona Moșescu. I'm going to talk about the role of patient organization in CF care. And I will invite Mr. Stefan Joris from Belgium. Thank you.
Thank you so much. It's a pleasure and an honor to be here. So thank you very much for the invitation to be here. Today I stand here before you to highlight a vital but yet often underappreciated element in the healthcare system, the patient association. And I will show you some slides that will show the activity and the mission of our own organization, but they're purely shown as a support for the message I'm about to give you. So if there would be any questions afterwards on specific activities or missions that we'll fulfill as a patient organization, please feel free and don't hesitate to address to me after the session. Thank you. Patient associations play an instrumental role in improving the lives of patients and their families, while also contributing significantly to the health landscape as a whole. First and foremost, patient associations provide a voice for people that may feel sometimes voiceless. They amplify the needs, experience, and concerns of patients and their families, ensuring that these perspectives are not only heard but also acted upon. In doing so, they foster a more inclusive healthcare system, where policies and practices are shaped by the real-life experiences of people living with various health conditions. This advocacy is crucial for promoting a patient-centered care. Patient associations serve as vital sources of information and support. They empower patients with knowledge about their conditions, their treatment options, and their rights within the healthcare system. By providing resources such as educational materials, workshops, and support groups, these associations help patients navigate the often overwhelming journey of managing their health. This empowerment not only enhances the quality of life of patients, but also leads to better health outcomes, as informed patients are more likely to engage actively in their own health and would actively be prepared to share data in order to improve the health of others. In addition to supporting patients directly, these organizations are also critical in fostering collaborations among stakeholders in the healthcare ecosystem. Patient associations bridge gaps between patients, healthcare providers, researchers, and of course, also policymakers. They encourage dialogue and collaboration, ensuring that the patient perspective is integrated into clinical trials and care practice, research initiatives, and health policy discussions and decisions. This collaboration leads to more effective treatments and services that truly respond to the needs of patients. They foster a sense of community. They bring together individuals to share similar experiences, creating a support network that can be incredibly comforting and motivating. In times of vulnerability, knowing that others understand you and empathize can make a significant difference in a patient's journey. Finally, patient associations have an important role in raising awareness about specific health issues, reducing stigma, and promoting public understanding. Through campaigns, events, and outreach initiatives, they educate, the general public and raise funds for research, ultimately contributing to advancements in treatment and care, and create societal support and awareness. This not only benefits current patients, but it also sets the stage for future generations. In conclusion, I may say that the added value and the impact of patient associations cannot be overstated. They advocate for patients, they raise funds for research, they provide vital information and support, facilitate collaboration, raise awareness, and cultivate community. As we continue to navigate the complexities of modern healthcare, let us recognize and support these associations for the invaluable role they play in enhancing the lives of patients and their families, in creating a more responsive and equitable healthcare system. Thank you.
Mulțumim frumos. Thank you so much, Mr. Stefan Ioris. În continuare avem și voi invita două doamne din...
And now I would like to give the floor to two women representing the Romanian CF patient organization, Oana and Georgiana, who will provide their experience and expertise.
Hello and welcome, and thank you so much for being here. As Bob said, we are here to give you the overview of the patient organizations in Romania. Of course, there are several associations for CF patients, but me and my colleague Georgiana are on the stage for the moment. In Romania, as you well know, there are 6 CF centers. The national center is based in Timișoara, where we have doctors specialized in CF. The patient associations are quite numbered. There are many such associations, but unfortunately they are not very well united. There's no federation, there's no unified voice representing all CF patients. And I think that this is one of our purposes, to create a unity among patients' organizations. Our association is called Together for Patrick. We started it in order to help our child who was diagnosed with this disease, and then seeing the huge challenges that we are facing, we realized that there are many other parents facing the same difficulties, and we try to help as much as we can. This association was created in 2019, and as I said, we tried to help as many people as possible, both in Romania and abroad, especially with their treatment. We had a very ambitious project called Back to School, where we helped 50 families in providing them learning equipment, especially for online education, because you know that a lot of children cannot physically attend school. Last year, we organized another conference in order to raise the awareness about CF, and we, of course, have lobby and advocacy activities. We also have managed to support this twinning project. And regarding our future projects, I want to mention the idea of creating a unity among the patient organizations. We want to create a foundation, a federation having a single voice when dealing with authorities. Another project which is undergoing, it's called cfhelp.ro. This is an online platform where both patients and caregivers can present their needs, their wishes, and this will enable the communication between patients, caregivers, and producers of medical equipment. And we also want to get the CF centers involved. This is quite an ambitious and vast project. There's also a part regarding the digitization. We want to create a database for patients in order to better manage the care and treatment. And now I would like to give the floor to my colleague and friend Georgiana, who will present her organization. Thank you. Hello, my name is Georgiana Nitsu. I would like to tell you that my story with CF started a long time ago, namely in 2002. That was the year when my child was diagnosed with CF. At that time, there were very few treatment options. The experience of the doctors, of the physicians, was also very reduced. The number of diagnosed patients was reduced, and the access to internet resources was not as widespread as it is today. There were a few years when I started researching a lot about this disease. When my child was diagnosed with this disease, I started learning by myself, and I realized that there are so many differences between what's happening in Romania, or what was happening back then in Romania, and what was happening in other European countries. In 2008, I founded this association, and I started a lot of activities meant to help the patients. First of all, we wanted to focus on lobbying. We had thousands of memorandums to the Ministry of Health and to the National Insurance House when we demanded the extension of free medicines and free treatment for CF patients, for medical devices such as aerosols, etc. We also had protests in front of the Ministry of Health, and these gatherings were joined by patients and parents, and we held discussions with the authorities in order to obtain several facilities, such as giving these children the status of severe handicap. and the inclusion of Kaftrio, for example, on the list of medicines with the costs covered by the authorities. From the beginning, we realized that the lack of information is extremely huge, and the first course that we sustained was given to the fact that we realized that there's no information about physiotherapy. And among the first courses, we had a physiotherapist coming from Budapest who was willing to share with us his knowledge. We also raised the funds. These actions of fundraising were directly from sponsors or by filling out revenues applications and tax applications. We also had school fundraisings. We also had actions such as swim-a-thon and other sporting events when we managed to raise funds to buy a Cineox equipment that we donated to a hospital. We also had awareness campaigns in order to raise the awareness of the audience and of the general public about the CF. We also had press conferences, press apparitions. We also had TV shows. And we also had an action in front of the Romanian Parliament where we spoke with the members of the Parliament in the lobby, and some of them ignored us, but that there were also members of the Parliament who were interested in knowing about our problems. I want to tell you that I am so happy that we are here and that we can hope to improve the standards of CF treatment in Romania. We made a lot of steps, and we are proud that Kaftrio and Calidepo are included on the national scheme, but as we mentioned this morning, and Dr. Liviu Pop mentioned also this morning, there's a problem of infrastructure. There's also the issue of the circuit of the patient in the hospital. There are no centers for adults. The adults are no longer treated as a severe handicap, although up to 18 years of age they are considered with severe handicap. We hope that there will be a consensus and that doctors will be able to have a single treatment in Romania, and I hope that we will implement the European standards for patient treatment. I would like to thank you for listening to my intervention, and I would like to thank all the parents who supported us, and of course all the physicians that were so involved in helping us. Thanks.
Right, so we had a series of talks all related to the twinning or to the situation in Romania, to patient organizations. So now it's time for questions. And let's do it in the ordered way. So I will open for questions the first two talks, which were about the introduction of the twinning in general. I don't expect moderators to raise the questions because moderators were the speakers. So I will ask the audience if there are any questions, either to the twinning from the perspective of the mic. So this, okay, all right. Thank you. To the twinning from the perspective of the ECFS or from the perspective of CF Europe.
Orice întrebare pentru domnul doctor, domnul profesor, pentru primele două topicuri.
So if you have questions about the first two topics, and then we will deal with the other speakers. If you have any questions about the first two interventions regarding the twinning project.
This early afternoon. We've heard beautiful talks about the twinning and all the successes, but what were the problems? And I'm not just talking about online problems, but what kind of things that you anticipated that could be barriers? What maybe the people who were experienced, what did they experience in barriers that they may have found, or maybe how they try to find solutions, also in expanding so much. I mean,
Trudy, thank you for this question. Yeah, definitely there are the barriers. It was very nicely presented by the experience from Belgium Romanian twinning program, and I could just repeat what's been already said. That so we identify very similar barriers on the global scale for other twins. It was the language, of course, the restriction to travel, but it was for the twinning one. The shyness, Mika mentioned that, and this is, I think, a big hurdle for the whole team. Not every single member of the team is equally, brave to contact the other side, to ask questions, maybe partially because of language, but maybe also because of the personality. So this is definitely something that we have to take into account. Now with the expansion from the project team, the trouble becomes with the funding, So we are very happy to hear and to see the interaction, that some of the sites are really active and want to meet each other, but there are some limits in the funds, and we can't easily support every single one to travel, at least to satisfy all the requests. So that's another issue, but we have to, of course, deal with this as well. Yeah.
Thank you so much. Thank you. Alte întrebări? Yes, avem întrebări, vin la dumneavoastră imediat. One second, vă rog.
No, it's not a real question, it's just a comment, and I forget to mention it during my presentation. Financing all these things is really important, but for all what we did online, we didn't need any money. We just needed some time, some effort, some dedication, and I think with these online meetings, we already did a lot of things, and we got to know each other, we already had a lot of interaction. What was a big struggle or a big realization for me when we were in Romania is that organization of healthcare from a national perspective or a local perspective really also has impact on how the possibilities to organize CF care is limited. For example, what really struck me was when Simona wanted to see a CF patient as an outpatient, and she wanted to do a sputum sample for culture. She had to ask the generalist to prescribe the sputum culture because she couldn't do it herself. And for me, this was like, who is the doctor? Who is the one who wants to do the decisions? And so these were like practical examples of how organization of healthcare really impacts what you can do and what you can change or try to improve.
excellent input on this bureaucracy type of thing. Let's ask someone else. We know what we have to do. Am o întrebare aici în spate, vă rog.
I welcome this conference. I'm Dr. Harutyunyan from Armenia. Do you, during this project, twinning project, this is a great project, do you take into the account socioeconomic status of the mentee side? Because you can educate, you can do everything, but sometimes it's very difficult to find money, for example, to create a physiotherapy service or to buy devices for patients. And for example, in Armenia, many of our patients, they live in rural areas when it's very difficult to get even simple medications. Do you take this fact into the account? Thank you.
Thank you for the question. I'm afraid that this is something that can't be handled by the European society. It's something that is up to the national societies and the collaboration with the patient organization. We've got the experience in every single country, struggling for funding, getting the appropriate facilities, equipment, the personnel being, paid for the service. So that's something that must be done on the national level, I'm afraid.
Okay, thank you so much. Alte întrebări? Any other questions? Comentarii, input, completări? Anything you need, orice aveți nevoie să spuneți pentru oricare dintre invitații speaker pe care am avut. Anything for any of the guests that we already had on the stage? Feel free. This is a good time to do it. As Dr. Moșescu said earlier in the beginning, I hope these 3 days will be good for you and you get all the information you need. Așadar, dacă aveți nevoie de orice formă de informație, ăsta e momentul. Întrebați pe oricine care e în domeniu, orice idee e binevenită. Any idea is more than welcome to understand. Yes, please.
Thank you for the excellent presentations. I think one question, how much does our learning experience, physiotherapy is one of the hot topics, not to teach a physiotherapist, to teach the patient directly, I think. How does this drive the force to get educational material on that or courses to train the doctor on physiotherapy or nutrition, because the multidisciplinary team could not be developed in one day. It's more one person in some countries who is responsible to be for many roles. And so I think this might be a topic.
Thank you. Mulțumim.
That's absolutely. I don't think that this is a question that I can answer. We might go maybe to the next 2 talks, because I had a very similar question actually, and that's about the dissemination of the experience and the sharing of the knowledge within the centers. So if I may,
Yes,
so I would now open the questions to the next 2 talks, which were both about the twinning experience, Romania and Belgium, and I would like to maybe to invite the 4 speakers to join me at the stage and to answer the question, because I'm sure there will be plenty of questions.
Absolutely, thank you. Așadar, speakerii de mai devreme sunt rugați să...
So the speakers that were on stage before are welcome on stage once more.
In case anyone needs any other questions. De asemenea, vă reamintesc, avem mai...
I would also like to remind you that we have several topics throughout the 3 days. After each topic, you might get the answer to your questions. Ladies, please come on stage. Are there questions for the next topic? Any question you might have.
Here, so
yeah. So sorry. So I will just follow on the question, which was just given by Professor Nerlich, and that was the question about the dissemination. So now it's more for this is a question actually to Romanian colleagues. Simona, maybe this is a question for you. One of the twinning ambition is once the centers from the country have some experience and get some expertise, they could disseminate it within country, because there are, and we know in Romania, there are not only 2 centers, there are at least 6 centers, and not all of them are participating in the twinning. So actually, how, if it works on the national level, that you are in touch with other centers and maybe share the expertise, or shall I? Yeah. So, any of you?
We have each year one meeting, I can say scientific meeting, with all the healthcare about CF once in a year, and we have some topics. I mean, lung disease, liver disease, and physiotherapy. And every time we have a speaker in physiotherapy. But the problem is not like this. It is the problem for the patient. Each patient should know how to do physiotherapy, because it's not enough to come to the conference. You have to do it by yourself at home. So for this, they have to learn all these techniques in the hospital during the diagnosis or the annual check, or during the exacerbations. And the physiotherapists from the hospital should come to the patient and teach him very, very good this. But unfortunately, in our hospital, it's not so good. It's not possible to be very dedicated for this, because all the physiotherapists in the hospital are for all the wards, not just for respiratory or pulmonology department. So we have to ask them every time to come to the patients. After this program, we have a very better, I think, understanding from them. I mean, they come easier to our patients, and they do the work as they should do. But after the physiotherapist Miriam from Belgium worked with them 2 days alone, side by side with, I think, 16 or 20 patients. And also, beginning with this training program, we gave them some devices, PEP masks, and learn them and teach them how to use this at home, beginning with the first year of life, and also some flutters. We bought this from the national program, and we gave to some of the patients flutters at home and teach them how to do it at home. So I think every center should find the ways to improve this for the patients in the hospital, but especially at home.
Ciola, do you want to comment on this?
Și acum, dacă îmi permiteți, eu o să vorbesc în limba română. Deci, pentru noi a fost foarte util vizita fizioterapeutului din Bruxelles. Giverny este o profesionistă adevărată și chiar am avut ocazia, deci s-a ținut și o întâlnire împreună cu părinții și chiar pacienți care au venit și din alte părți, nu numai doar din zona noastră.
Coming from all sorts of areas. She managed to show the patients that were admitted to our hospital how to do the physiotherapy exercises. She showed mothers, for instance, how to do kinetotherapy with newborns. We also had colleagues over from other clinics. And we also had our kinetotherapist. And she was very open to learn the new things we were taught. For us, this meeting was extremely useful. Thank you.
Yes, yes.
Hello, my name is Lavinia Cârstocea. I'm really nervous, I'm sorry for that. I'm the mother of a son with cystic fibrosis. As the lady from Armenia was saying, speaking of medication, I would like to know that within this twinning project you took into consideration the option of medication. I'm not talking about modulators here, I'm talking about antibiotics, vitamins. We've all come across issues. We have been taking vitamins from Italy, for instance. So I wonder if there's any option to get vitamins from hospitals or from somewhere that's easier, so that the vitamins get to us easier, so that we don't depend on couriers and other people. Thank you. I don't think that the twinning program refers to funds for patients. It's about improving the quality of care standards from all perspectives. I'm talking about all the sides, all the chapters of this disease for hospitals, for patients, but it's not about funds for parents. No, that's not what I mean, in fact. Let me get this straight. I'm talking about accessibility. To have better access to medication here in our country. Well, we have all our vitamins, all the vitamins here in the country, A, D, E, and K. Right. Hello, my name is Alexandra Kelban, and I have two sons. They're 7 years old. From the beginning, we've been very concerned. We've been trying to come up with answers and solutions as parents. As parents, we always ask ourselves, do we do enough? Do we do things right? Because here in Romania, we've been talking repeatedly about the lack of specialized persons for respiratory physiotherapy. So we try to come up with solutions. I don't think that our access is necessarily limited, but it's quite difficult to find people who know their job and who have good results. Professor Bon was saying before that within this twinning project, she saw a few gaps between what's going on in Belgium and what's going on in Romania. Could she give us a few concrete examples concerning these gaps? Because we always get this impression that we do the wrong thing or we don't do enough. And medically speaking, are there noticeable and notable gaps between Belgium and Romania? And when it comes to the general protocol for medicine and medication, what are the main gaps? Thank you.
Thank you for your question. And I think it's really challenging to be a parent of a patient with CF if you know what happens in your country versus what happens in my country. There are differences, but as I wanted to explain, there's also a lot of possibilities in here. You have the same access to Kaftrio as we have, which is a very, very good thing. But of course, there's the differences. And what we noticed as one of the big challenges is organization of healthcare. And that's actually just on a national level. There's not a very easy way to change these things. It's about reimbursement and funding of physiotherapy. It's about education of physiotherapists. It's about having the people interested in a very rare disease like CF. And that's why we think it's important to include the patients and to try to educate the patients as much as possible. That's what we wanted to do when we visited Bucharest. We had real on-hand session with our physiotherapists, with the patients, with the parents, to instruct the parents how to do the physiotherapy on their own. And I think these things are feasible, but these are, of course, on a very small scale. It's only a few patients where we had these educational sessions. We also tried to involve the physiotherapists from the center, but as Simone already mentioned, these people have a lot of other work and a lot of other tasks to do. The hospital where she works is a very big pediatric hospital, but it's mainly organized around orthopedics and surgery, and there's not too many interest in these rare diseases, which is of course a pity. And I think an important message for you as a mother of a patient and for people who live with patients with CF is try to be involved from your own side and trying to learn as much as possible and to do as much as possible and try to have some impact. And I think working together with the patient organizations is a very important way to try to tell the people from the government and from organizational departments how to change and how to improve care.
If I may, this is just a perfect quote, Mika, and that's exactly what I wanted to say as well, both on the last as on the previous question or comment. It is true that it's not easy to have access to everything, to have access to information, to try and do the right thing. And I can only echo what Mika said, it's extremely hard. And that is why not only patients need to be involved, but patient organizations need to be involved. And that's why we work together, because it's another way of spreading information between families. It's another way of getting to the decision makers and try and get more goodwill, more access, more interest for CF. It's about, it was on one of my slides, it's about advocacy, it's about fundraising, it's about doing this together. And as one CF center can't make the difference for everybody. One patient or mother or father cannot make the difference for everybody. But if we are in this together, and if as patient organizations, as CF centers, as CF Europe, as ECFS, we try and spread the information, inform people, bring people together, I'm convinced that we can reach many people.
Okay, no, go ahead. Thank you. We still avem completare. Go ahead, please.
Just a small remark, something that I experienced when working with Chile. We live in a very small country. Belgium is very, very small. We have 7 CF centers. I understood that transport in Romania is not always that easy. So if you want to get to come to the CF center, to come and see a CF expert, it is much more difficult than in our country, for example. And so therefore, I think education of patients and family is even more important, because you need to deal with it at a certain time. You cannot always go directly to the CF center. So that's one of these challenging things, but that's something we can work on by educating patients with CF, but also families, by supporting them and telling them what you can do from a distance. And we have learned a lot of it during the COVID pandemic, and a lot of topics will be highlighted during the next sessions on that.
Ok, thank you, Elke. Georgiana?
Da, mulțumesc. Referitor la fizioterapie.
Physiotherapy now. As I was saying before, I admitted early on that this is quite a challenge in Romania for CF patients. There's a lack of information about it and a practice and experience about it. So the first course we organized was a physiotherapy course. During the next conferences, we will have theoretical and practical physiotherapy sessions as well. But what I did want to say was the following. for those parents who are interested. 7 or 8 years ago, together with MUCO, the German Association for CF, we managed to translate and publish, and we were approved to disseminate a physiotherapy, an updated at the time physiotherapy handbook. If you're interested in this handbook, I can send it to you in PDF form. Thank you. I have a question. I'm curious.
To know who our guests are today. Cine sunt oaspeții noștri? Dacă îmi permiteți și nu e dificil, puteți, vă rog, să ridicați mâna.
Could you please put up your hand if you are parents or families of patients with CF? Please put up your hand so that everyone knows who is here in the room today. So all the hands are families or parents of CF patients. Thank you very much for coming here for the second year in a row.
Vor fi toate 3 zilele, adică aveți întrebări, aveți curiozități, aveți nelămuriri,
Thank you so much. I am sure that you have a lot of questions to ask, you have frustrations to share, and I'm sure that this event will help you. There are other questions, but I want to make sure that if you have questions for the first part, don't hurry, we have the microphone. So I wanted to ask you, when we first submit the application form, what is the waiting time for the mentee to get approved? In 2020, when we first introduced the twinning project, it was September 2020, and in November we already got the acceptance reply, and in December we already started. So about 2 months, right? Yes, I hope this is a satisfying answer. Are there any questions?
To understand the training program and its timelines, it's not open during the year. So there are the calls, and there were 2 calls so far. And during those calls, of course, the applications can be submitted, and then the board, the evaluation board, is doing their job, as soon as possible, coming with conclusions, which sites become members of the twinning. But for now, there is no call open, so there is no recruitment now possible.
Thank you. Ok. Completare, vă rog. Sigur. Scopul e să lămurim.
Aș dori să fac o sugestie bazată pe remarca domnului Drevinec, și anume referitor la centrele care sunt parte în proiectul Twinning de la Cluj și de la București, dacă ar putea să se organizeze între medici, evident, sesiuni live sau grupuri de WhatsApp sau ce-or fi, pentru diseminarea informației și experienței. Cred că ar fi foarte utilă pentru pacienți, pentru diseminarea informației, pentru schimbul de experiență. E doar o sugestie, eu cred că ar fi foarte util. Asta ar însemna, evident, crearea unui grup de lucru care să discute lunar, odată la 2 luni, săptămânal sau cum credeți dumneavoastră, și fiecare să-și împărtășească cazuri, probleme și așa mai departe. Asta este sugestia mea.
Ok, mulțumim.
Maybe if I can start, Cila and Simona. This is, of course, very reasonable, and that's one of the ambitions of the twinning, or maybe the next step. But we must be aware that the mentees are the sites which are in training, and they've got their limited capacity, they don't have the team complete, so they are in a very similar situation like the others. So we can't just easily say them, because you are now in the twinning, you become responsible for the rest of the country. So that's just, you know, yeah. But as I said already, it's about also their capacity and possibilities, what they can do. But absolutely, you're right. So.
Yeah. I think it's a good suggestion just to share materials and information we have, but of course we also have the educational platform for that, to share general information on CF. And I think one of the advantages of these personal contacts is that you can discuss on individual cases and on individual problems or struggles, and this may be different in different centers. So some of the material could be shared and could be dispersed, I guess, but for other things, the personal approach can also be very advantageous, I guess.
Yeah, I would also refer to the talk of Chris Smith tomorrow about the educational materials, which shall be freely available to all the centers from the country where the twinning is, open. Yeah.
This meeting will be a discussion about the centers in Romania.
Bun, e minunat atunci. Ok.
And the twinning program is our chance to talk to somebody else with a much more experience to teach from them, to learn from them. So.
Bun.
This is the main.
Mulțumim frumos. Eu trebuie să țin și orarul. Cea mai grea.
Thank you so much. Well, my biggest challenge as moderator is to keep the time. So I would like to give the floor to Hilde, Stefan, and Oana, because before the break, you will receive the diploma for thanking you for your presence here today. It's just to show our gratitude towards you. That's the least we can do. A small token of appreciation. And now let's have a group photo. Thank you so much for attending this first panel. Now we have a 30-minute coffee break. I will be missing for the second part, but I have Dragos replacing me. So Dragos, your main job is to gather people at 3:30. So please don't be late. Dragos will make sure that we keep up to the schedule. See you tomorrow morning, but you will be back soon. Thank you so much.
Doamnelor și domnilor, vă spun și eu bun găsit și îmi face o mare plăcere să fiu astăzi aici, într-un loc în care pot să ies din obișnuință și din area mea.
Ladies and gentlemen, I'm so happy to be here with you today.
Cystic Fibrosis Foundation, Cystic Fibrosis.
I am happy to learn about this play on words with cystic fibrosis and cystic fibrosis. My name is Dragostan and I'm replacing my colleague Bob. I know that I look exactly like him, but please don't don't mistake us.
Sesiunile anterioare vom avea un Q&A, un question and answer session, dar asta se va întâmpla la final. Până atunci îmi face o deosebită plăcere să invit pe cei care vor sta pe fotolii. I invite Mr. Lutz Nerlich, consultant of ECF as Patient Registry, pe domnul profesor Liviu Pop and Miss Katarina Stepanovka, SIFI Europe Ambassador. Please take a seat on the chair. And the first presentation will be of Mr. Lutz Nerlich, and it's about the importance of ECFS PR situation in Eastern Europe. Thank you.
Hello, good afternoon. I think it's a pleasure to be here and to speak about registry. I think I was asked to show a little bit the importance of the European approach of a patient registry run by the European Cystic Fibrosis Society and to focus on the situation in Eastern Europe, I think. So, I think CF in Europe, it's one common goal and one common issue for all of us. And there are many questions. How many patients are there? What is the prevalence? What is the genetic background? What are the age distribution? What is the situation of lung health? What is the nutritional status? The access to treatment? And each country, and we learned that today, I think, has an own situation. The economic situation is different, the healthcare system is different, and the access to diagnosis and treatment. But our common goal is to cure CF and to get the best care for every patient in Europe. In Europe, we have over 45 countries, and in the EU states, around 26 countries. That's a huge challenge, I think, to overcome. To answer that question, I think in the US in the 60s, I think the first patient registry was started to collect patients' information on a longitudinal basis, I think to describe the disease and the burden of treatment and also the progress with different interventions. This situation was, I think, adapted in Europe, I think in the larger Western European countries in the 90s, I think like France, like also Czech Republic, it's not here, but I think Germany, Sweden, UK, Ireland, and so on, I think, in some countries. But this is only a part of the European network, and the European Cystic Fibrosis Society, which is not a foundation, it's an association of caregivers, starts in 2003 an initiative, which was very ambitious at that time, to have in the WHO region of Europe, including Armenia, Georgia, but also Kazakhstan, have a common governance and data protection model and use pseudonymized data without identifying data of people with CF who are consenting to the registry, and have agreed inclusion criteria and a harmonized data set to compare the data across Europe. And I think we are offering a data collection platform for the countries who have no national registry, who have built up their, not the capacities to build up their own registry software and their own data management. And this started in 2011, and I think it was a very promising start. And now epidemiology, research, and also the long-term effects of new medications called pharmacovigilance, I think is also part of our topics. Why do you need a patient registry? I think it's part of the puzzle. I think you have education, you have care, you have patient organization. But I think you have to know how many patients do you have, in which situation are they, what's the genetic background. That's for the patient to advocate for that situation, but it's also, I think, for researchers, for the healthcare authorities to believe in the healthcare system, to see is it 10 patients or is it 500 patients. That makes a huge difference in efforts and in budgets, for example. What are we collecting? I think it's always the balance between quality and quantity. It's just about annual outcomes, so it's 1 yearly, it's core data, the genotype, the diagnosis, the demographic, but we have also the annual data, I think, on growth, lung function, microbiology, complications, also therapies, and also pregnancies. So far, I think we have achieved, I think, to get in 2022 all the countries in from 39 countries we get the data. Estonia is the latest member, I think, from 2023, so it's 40 countries. This is a map. All the countries, especially in the Eastern European sides, are involved here. And this is a great success, and we are working on the last, like Kosovo, like Bosnia, and we hope to overcome that soon. It's 54,000 patients with CF, and I think it takes quite a situation that we have nearly in every country around 80% of all the patients in the registry. This is not achieved, for example, in Romania so far, but now we have adapted it with 2 adult centers stepping in for this year the first time. So I think it's a growing involvement also with the Ukraine with more centers despite all the war, with other countries as well. But for most of the countries, over 80% are in the registry. And one of the outcomes, I think, of these great efforts, I think, is an annual report displaying the data for whole Europe, but also country-wise. And that's published every year after the data are collected. So the latest report is 2022, and you can get it from the on-site, and there's also a highlight report. If you go for the number of people in 2022, I think there are quite a large number, I think, but a huge diversity in number per country. We have on one side the largest country like UK with 11,000, but also I think the smallest country like Iceland with 15 patients. And you can imagine how different the healthcare system is and how important the disease is in the healthcare system despite all these differences. The largest country are UK, France, Germany, Italy, and then there are a middle one. And I underline a little bit the Eastern European countries because I think it's very important. Altogether you have a substantial number of patients, but each country has quite a limited one below 500, except Poland, who has around 1,800 patients in the registry. And this is, I think, from 2022. So for Romania, now we have 400 patients and 2 additional adult centers. We will change some of the data we will show here as well. What is the prevalence of cystic fibrosis? How often in 10,000 inhabitants there is 1 patient with CF? And this differs quite a lot. And I think you see it here on the map that UK has not only the highest number of patients, it has also the highest prevalence of this disease. That's based on genetic things, backgrounds, but also in the middle part, I think Germany, France, Switzerland has also quite a high prevalence like Italy. And then there are other countries where you see lighter blue, which have a very limited one. So you see that 3 out of 10,000 inhabitants in the country are affected by CF in Ireland, but we have also countries, I think, like here in Romania, where the number reported is very low. That has to do with the genetic background, with the incidence of the disease. For example, we know in Finland the genetic background is very low, but other diseases are more common. That has to do with a way of diagnosis. Sometimes it's a hardly underdiagnosed tool. Newborn screening plays a role, sweat testing plays a role, awareness of the doctors plays a role, so that's something. Under-reporting, I think, bringing the people to the centers who participate in the registry. And we have also, in some southeastern countries, I think the problem that patients die even before the diagnosis because of salt loose syndrome in the heat. That's an early manifestation, and we have also this involved here. The geographical distribution, I think, of Delta 508 is very important this time, because I think, as you know, I think it's an important indicator for genetic treatment and modulators like Kaftrio. Here you see, I think, on the map that Delta 508 variant is also slightly different. In Turkey, you have only 20% of people with CF who have at least one Delta 508 allele. And then you have Denmark and you have Croatia, where it's really 90–95%. And Romania is quite in a good situation with a homozygote in dark blue and the heterozygote. So around 90% of the patients in Romania have at least one Delta 508 allele. I think the proportion of children and adults is depending on the centers who are participating in the registry. As I mentioned, for 2023, we have also 2 adult centers for the first time, though this is quite not reflected in this data. But you see here underlined a little bit the Eastern European countries, that the proportion of patients across Europe is now around 50%, I think, adults, and in most of the countries that's much lower, and that will be the future, I think. And look at countries, I think, like on the left side, I think you see that there are countries who have at least 60–65% of adults in their population. The lung function is reflecting, I think, the reality in countries. And it's always very diverse, and now with the access to the modulators, it also brings a huge variety. And you see that, I think, here. Each country is one dot, I think, and you see in purple, I think, the median way of FEV1 per age group, and you see that the patients started high, but in some countries it's around 100%, and in the other ones, the lowest one is 85% at 6 years. So it's always, I think, differences over time. The Romanian population, I think, we have in the registry, I mentioned the adults are not well covered here, but I think you see it's slightly below that median, but I think that is 2022 data. If we come to non-genetic causes, I think, and complications, chronic Pseudomonas infection in children is a very robust indicator, I think. And you see here, I think, the prevalence, I think, of these complications across Europe. You see that there are countries who have less than 10% of children and adolescents with a chronic Pseudomonas infection, and you see there are some countries with over 20%. And you see it here in, I think, remarkable data from Norway. Might be the temperature and the climate plays a role, but less than 1% are chronically infected. That could be achieved in Europe. And you have other countries, I think, like Moldova, where 41% are suffering from that. So the need of inhaled antibiotics and strategies is definitely stressed. And I think you see here in Romania, I think with 22% of children and adolescents, I think it's in the middle, I think. This has to do with the healthcare system, how often you check, what are your diagnostic tools, what are your therapeutic options, like what is the prescription for an eradication strategy or for a chronic, and what is affordable for the patients, I think, itself. But also modulators plays now a role, because with less sputum, less detection of Pseudomonas has been seen, might be not so clear now, but there might be a reduction in early and chronic infection on the way for the younger population. So the strategy around that is at least as important in some countries as the modulators itself to prevent hospitalization and others. The pancreatic insufficient, I think, this is a little bit reflecting the genetic background, I think. And you see here, I think, in Romania and in all the other Eastern European countries, more than 80–90% are pancreatic insufficient. But there are countries, I think, like Italy or so, where you have only 60 to 70%. So if you compare countries from the western part with the eastern part, this is quite a challenge, I think, on the way to compare and not to miss that. Because patients who are pancreatic sufficient normally have a slightly better life expectancy and also a less burden of therapy. If we look for the nutritional status, and this is also something which is very important, I think you see here all the countries and all the percentage of children and adolescents who are malnourished, I think, compared to the age groups, I think, to the countries divided in male and female. And you see, unfortunately, that also this is a challenge on the way where the data can be improved, and what can be achieved in one country could also be, I think, the goal for the next steps. So nutrition is, I think, a challenge in most of the Eastern European countries. Higher rate of malnourished patients, I think, might be reflected also the fact of the modulators who really bring also some weight gain in. And if it comes to the modulators, I think, and I would say in some countries like Armenia, we heard that only 40% at least will be, or at the end will be eligible right now. So there is a substantial number of patients who will be not eligible, especially in the Eastern European countries. But the number of eligible patients has expanded with the expansion of the indication of the modulators. And you see here different colors also. I think ETI is here in the more lighter blue, and Orkambi, I think, is in the yellow. And you see there is an eligible group not treated, and this is really the fact also in Germany. But I think over time the eligible patients have been spread from 45,000 patients to in the whole group to now 38,000 patients. That's a huge achievement, and 25 out of that are treated with Kaftrio. That's a great achievement over time on a European perspective, and 73% of all patients eligible are on modulators, so there is room for improvement. Why is it, I think? And here you see it for children and adolescents. I have to say this is 2022 data, so it's not reflecting the latest year. But you see in many countries, in some countries, 100% of the eligible patients are treated, and in some countries like Albania, Lithuania, Moldova, so near countries, I think there is not even an access in 2022. And Romania, I think, is a little bit more on the left side, like all the other Eastern European countries, but has achieved quite a lot, and I think it will achieve, I think, in 2023 also an increase, especially with more adult patients. But you see, for example, how different the system is. If you look for the large yellow bar, I think that's Latvia. In Latvia, we have been, I think, and Delta 508 homozygote patients are not eligible for Kaftrio. They got Orkambi. That's a restriction by the authorities. They fight hard for it, but I think that shows how different the situation is from country to country. If you look for the adults, it's even promising, I think, but you see the same countries who are lacking access or have problems with access to the most efficient modulator, I think. And here you see Romania on the right side of the Eastern European countries. I think you could be proud of that because 90% of the eligible adults are on that medication. I think this is a great achievement which will also change the care structures over time. So, coming to a conclusion, I would like to show you, I think, that the registry built on commitment and trust. It takes a long time, and Simona started in 2007, I think, in Bucharest to work with us, and it takes quite a long time, and we are not at the full potential in Romania. We are missing the adult centers in some centers. But I think we show that the diversity across Europe, especially in Eastern European countries, I think it's very important to display. And every patient from my side has the right to be visible because every country has its very specific background. There is a positive trend, I think, towards access in all the countries, I think, in Europe, and a great improvement over time in the outcomes. I haven't shown that. step by step where you start from. And I think it's a pan-European participation. It's the largest CF registry worldwide. We know from latest publications that around 100,000 patients are known worldwide by registries, and we are contributing 45,000 from 40 countries. I think that's a great effort to make epidemiologically wise different. To highlight the country situation, learning from each other, like the Latvian group, they can show that to their authorities and said, why are we here behind? I think behind all European countries, I think. That is a visibility and a learning process. And it's an important research tool for the upcoming challenges like the adult care. If you have been facing with higher number of diagnosed patients and more adults, I think the adult care structures are very important for the future, as in most other countries. And this is a challenge also in the care structures. And I have to thank all the patients and family who give us their informed consent via the centers which are the important transmissions, I think, between us and the country. The national CF registries who work closely with us, and CF Europe, and also our statisticians at the University at Milan. And I think without the ECSF and the vision to display that, I think nothing would be at that stage. So I think it takes 20 years to get to that, and I think it's quite promising, and I'm very enthusiastic that we achieved that, and I hope it will gain more information over the next years. And it's a lifelong sustainable product now, I think, and it can help you, your parents, your caregivers, and also the researchers in your country. Thank you very much.
Thank you very much, Mr. Lutz Nerlich. Următoarea prezentare îi aparține domnului profesor.
The next presentation will be given by Professor Liviu Pop, and it will be about the role of registries in improving the care for CF patients in Romania. Thank you very much for inviting me. I would like to thank Professor Lutz Nerlich for his presentation, because he made things easier or more complicated for me. I don't know yet. Because in my presentation I will use the same information from the European Registry, but because it's good to repeat things, because that's how we learn, I think it will still be useful for us all. I started with this highly known visual concerning how figures have evolved for CF. And I couldn't help it. I wanted to put the pioneers of research in CF, starting with Professor Dorothy Anderson in 1938. She first described this disease as a standalone condition, moving on to Distant Agnese, who discovered the relevance of higher sweat and worked towards realizing the sweat test, which was later developed by Gibson and Hook. And then, towards the end of the 1980s, when the protein and the gene for CF were discovered by the Golden Trio, so all this period set out to improve the state of the condition of CF patients and aimed at improving their life and get it as close as possible to a normal life. In time, this led to a change in demographics. What do I mean by that? I mean that the adult population became ever more numerous. And this is the current tendency as well, the current trend, which is normal because newborn CF patients are within the normal range, while the adult population keeps growing since the healthcare conditions improve. Also, lately, we have been blessed with modulators and other innovating therapies. When gene therapy is introduced to the market, things can only get even better. This is a highly complex condition. A patient can be an atlas of pathology. So given the situation, we needed to draw up such registries in order to get a better general image of what's going on with this condition. The European CF Society has specialized working groups for pancreas, for the liver, for nutrition, for physiotherapy, for nurses, because this is a complex condition, because this involves a multidisciplinary team where everyone knows what this disease is about and where everyone is specialized. And this is the main concern nowadays for Romania. In the current situation, in the current context, this is the hottest potato, I think. Speaking of these patient registries, obviously these manage to facilitate access to standardized treatment. Based on best practices, on outcome monitoring, and you've listened to Dr. Nerlich for sure, and we'll see this up next as well, that these registries allow for a sort of monitoring. They allow for a comparison between how treatments are applied, how the patients are evaluated and assessed. Comparing performance between medical centers from various countries or within the same country. There are 6 CF centers in Romania, but there are certain differences between them. Moreover, the disease is so complex that we cannot possibly have one-size-fits-all treatment. And this treatment has to adapt for each patient in part, starting from various aspects. I hope you can hear me well. From various aspects, fundamental and mandatory aspects that are used in the assessment of patients, improving health policies. Having these registries, it makes it easier for decision makers to access information when they organize themselves, when they want to sort out the financial approach to certain situations. Because, as I was saying, this is a complex condition and it can be expensive. In Romania, the decision makers don't always ask about the situation of CF patients, unfortunately, but hopefully this thing will change. An increased access to information for professionals, that's also important, including when it comes to the monitoring of medication and interventions. We and our patients are really happy about the new modulators and modulator therapies. However, things like liver problems that were anticipated in clinical trials and others that have cropped up in the meantime. And I will give you an example. The psychological aspects, that brain fog. So some things haven't always become clear following clinical trials. But this new kind of information helps professionals collaborate better and better understand what happens and when it comes to potential side effects or positive outcomes of treatments. International cooperation, strengthening it would be a very good means to ensure cooperation when it comes to standards of care and knowing more things about the condition. Those of you who listened to Professor Nerlich's presentation better understand what's going on in the world right now. But we'll see what happens in 4 years' time. Here are a few slides from the European Registry. I will not repeat what Professor Nerlich has already said, but I'd like to highlight one thing. It is important that the CF centers in Romania communicate the information to the European Registry, out of the reasons I have already told you. When it comes to reporting, Romania lags a bit behind. But things are picking up, I think. And for sure, this will be visible in the next evaluations. In 2017, I don't know if you can see this from the back of the room, but the increase in reporting is small but significant. A small step, just like the moon landing, a small step for humanity, but a big step for CF in Romania.
Putem aprecia modul în care se ameliorează.
Here we can see how diagnosis improves as well. Because the crux of the problem is an early diagnosis. The infection with Pseudomonas and whatnot in Romania are lagging behind when it comes to reporting. Because we have late diagnosis for children and we have children diagnosed in time who have very good evolution. So the average, the means, positions are somewhere in the middle, as you could see in that slide. We're still lagging a bit behind when it comes to adults and children. In 2017, we were ranking last. Now we're second last, just before Belarus. But we're optimistic.
Vârsta de diagnostic, așa cum am spus, la copii și la adolescenți, după cum vedeți în slide-ul respectiv, se întinde până după vârsta de 2 ani, dar, totuși, din punctul cel puțin al meu, este remarcabil că
What is remarkable is the fact that many of these children are diagnosed before they are 1 year old. But again, what I want to say is that the data is aggregated. Because since 2022, we've had access to newborn screening. I'm sure that by the next assessment by the European Registry, the situation will be considerably improved. When it comes to gender distribution, it is very similar to everyone else. And the distribution for children diagnosed before 3 months and diagnosed by 18 years old, the situation in Romania is not all that bad. And I want to say that over the past few years, things have improved considerably. The reason is that there is a better access to treatment, and as you were saying in the first session, there was an improvement, a slight improvement in physiotherapy. We do well when it comes to the identification of pathological alleles, but everyone knows that gene diagnosis is still a problem because it is not supported financially in Romania. But we do have access to a modulating therapy. And we do need to know the genotype of each case in part. Professor Nelly showed you this as well, the incidence of the mutation. Back in the 1990s, when there were just a few cases, I still remember the first cases I diagnosed. We diagnosed in Manchester, showed an incidence of 25% of Delta 508. We have a mutation of Delta 508 comparable to the surrounding countries. Here we see an example of spirometry as it was in 2017 and in 2021. There is an improvement. We gained a few extra liters, which is very important when it comes to breathing with CF patients. In conclusion, European registries are a very important tool in improving treatments, in strengthening international collaboration and research. The benefits are clear for the patients, because it is mainly for the patients that we do this, and it also they also help to have a better relationship with the decision makers, because with their help we can provide very swift answers in order to get the necessary funds from decision makers. I would like to close with a few words on a meeting that took place in March at the Embassy of the United States. There was a round table there to talk about the current situation of CF in Romania. In March was the second meeting. The first meeting took place in 2022. At the meeting in March, we tried to bring to the table the needs of CF patients, to talk about our medical needs of those who take care of CF patients. And we wanted to bring all these together and take them to the relevant forums. At our meeting in March, we identified various issues. A belated notification of the family when it comes to newborn screening, collaboration for screenings. There are still a few issues there. I don't know if the screening is done rightly now. Bucharest has to bear the brunt of over 90% of counties in Romania. Timișoara, the center in Timișoara, caters to about 2 counties. This is not equitable, I think. But these things do not pertain to us as physicians. They pertain to the broader logistics. Barriers in care for adults. This is another topical issue, and I hope we can overcome it quickly. And there's one more thing, challenges in gene testing. This still means a considerable financial effort from the family. So, given this context, we made recommendations towards the Ministry of Health about increasing the availability of gene testing. This is mandatory in order to be able to see if the patient is eligible for modulating treatment or not. Improving the performance of screenings. Indeed, this is just at the beginning, but it's not all right for the patient to be informed after 3 months from the screening that his test is positive. And an increase in availability for sweat tests. The sweat test is still an essential factor in identifying CF. Thank you.
Mulțumim și noi domnului profesor Liviu Pop pentru informațiile folositoare și prețioase. Aflați că următoarea prezentare aparține
Thank you so much for this precious
Dr.
intervention,
Laura Larisa
and now we
Trecea,
would like to
medic
give the
primar
floor
pediatru
to Professor
la
Dr.
Spitalul
Laura
de
Larisa
Copii din Brașov și
Dracea
conferința era
from
acolo.
Brașov.
Iar tema prezentării este
The topic
situația în
of her
centrele
presentation
de
is
tratare
the
a fibrozei
role
chistice din România.
and the situation of CF centers in Romania, the one in Brașov, more particularly. Good afternoon. I'm very happy to be here in front of you today, and I am happy that we, as a country, we have a voice in Europe.
Eu am să prezint, de fapt, situația Centrului Regional Brașov, cum am fost desemnată să o fac.
I will give you more details about the regional center in Brașov. I will briefly mention the history of this center and how CF started, CF Care started. In 1999, the first steps were taken in Timișoara. At that moment, the coordinator was Professor Ioan Popa. And then I started learning about the disease and about the CF care by also having 2 European fellowships in The Hague at the Juliana Children's Hospital, coordinated by Ian Cowenberg, and then at Rotterdam at the Sophia Children's Hospital under the supervision of Dr. Tiddens and Dr. Johan de Jongste. It was very difficult for us to diagnose. We had a very old device for the sweat test, and we felt underwhelmed by the situation of the children. There were many deaf, malnourished or undernourished children, and we felt that it was mandatory to do something to improve the diagnosis and the care of children. We were lucky enough to receive a grant financed by the University of Louisville in the USA and also financed by Humana Foundation. And with that money, which was quite important, $11,000, we bought aerosols and we published leaflets for patients. In 2003, I had a research fellowship at James University Hospital in Leeds, where I spent 3 months under the supervision of Professor Dr. Steve Conway. In 2006, we founded the regional center in Brașov, the regional CF center in Brașov, within the Clinical Children's Hospital in Brașov. At the moment, we care for 45 patients. 3 of them were referred to adult care this year. So we had 45 8, but now we still have 45. And we supervise 3 counties, Brașov, Covasna and Harghita. Of course, we also receive other patients, even if they come from other parts of Romania. For the moment, we only have 1 patient who is outside these 3 counties that I mentioned. Our regional center is under the in the building of the pediatric clinic. Our department has 35 beds, and we were lucky to have an improvement by the foundation Dăruiește Viața, where we have 5 wards dedicated to 5 patients suffering of CF. This doesn't cover the needs, of course, because we need more wards dedicated to this, and sometimes it's very complicated to isolate these patients. We have a permanent hospital admission of 2 to 6 CF patients. The isolation is difficult, as I told you, and it is important, especially in a big hospital and during epidemics. We do have nurses that were trained for CF since 2000 and who are very dedicated to the care of these patients, but they also are involved in the care of other patients too. We have 2 doctors who are younger, but I hope that I convinced them of the importance of caring for these patients. And we also have other specialties: surgery, ENT, ICU, physiotherapist, diabetes, but none of them have a specific training for CF. From the point of view of our equipment, we have a Hill-Rom vest, which was donated by a CF parent from Vancouver, Canada. We had donations from abroad, and the people were impressed by the conditions where we work. We also have nebulizers, we have spirometry, which was also donated, and we also have a device for the sweat test. The biologic assessment and the imaging come from hospital funds, but unfortunately the multidisciplinary team is not trained in CF. Regarding genotyping, for a long period of time we've sent blood tests at the National CF Center in Timișoara, and we also received help from the Royal Children's Hospital in Manchester. At the moment, we do our genotype and genetic tests at the Bioclinica lab. The costs are not that high. Regarding sequencing, I can tell you that we had a very good cooperation with Macek, and sometimes also we had fewer patients who needed sequencing, and I think that we will collaborate with the ECFS from now on. And the programs that take part in take a lot of time. From the point of view of the genotype distribution, in Brașov we have this distribution. We have only 7 children who have the second mutation. And as I said earlier, only a few children who needed sequencing. I think it was only one family with 2 daughters who have mutations which don't make them eligible for modulators. The communication with our patients and with the doctors and with the physicians. With the patients, the communication is easy, but it's time-consuming because it's by phone, by WhatsApp. The patients have my phone number, my colleague's phone number. We do everything by phone, even the checkups. We schedule the checkups, so we do the prescriptions. During the pandemic, we had low hospital admission, and we had good outcomes. We had 2 children who also suffered of COVID, but it was a good outcome. From the point of view of the collaboration with the general practitioner, we can see that there's a poor knowledge and they are involved in minor illnesses. And from the point of view of the relationship with other pediatricians in local hospitals or regional hospitals, we have a good communication. And most of those who are in our local hospitals, they are former trainees, but their knowledge is still limited, but at least they are referred to us. This is more in the neighboring counties, such as Harghita and Covasna. From the point of view of the knowledge that we need to have, and from the point of view of the training, in order to organize a multidisciplinary team, the knowledge exchange is with the other center coordinators and at European level. We must admit that the community is very receptive and the doctors always help us when needed, especially if we have different regarding the needs that we have, and we have a great support. Of course, we take part in congresses, conferences every year, and some of us are involved in different working groups, such as newborn screening and ECFS. The transition is becoming more and more frequent. The patients that we've taken care for 12 years or several years now, they turned 18. In our center, we had 3 patients who turned 18 this year, and 11 in total. The issues with the patients who have become adult, you are very well aware of them. We have a doctor who is dealing with the diabetes patients, but don't have a specific training, and you can see on the slide what we need and what we have. There are many difficulties, many challenges. We have many patients coming from the rural area and who have a very poor socio-economic situation. They have 2 or 3 children suffering from CF, or who always had children who had died because of CF. They have a low compliance and low adherence to the treatment. More often than not, we have to ask our collaborators
și care ne pot ajuta. Ce scuze. Ne lipsește echipa multidisciplinară.
we lack the multidisciplinary team.
Facilități pentru îngrijire, pentru izolare, pentru
We lack the care facilities. We don't have the possibility to isolate our patients, and unfortunately, we had a premature death. But the situation has improved lately.
pacienții care sunt pe terapie modulatoare. Deci, din punct de vedere al terapiei modulatoare.
But we also have improvement in modulators, and this has led to improved outcomes.
Procesul de inițiere este destul de încet din cauza lipsei facilităților de internare și evacuare. Sunt 21 de pacienți.
The initializing process is very slow. The process of initiation is very slow. We have 21 patients, 3 patients over 18, 8 between 6 and 12 years, and 10 patients after over 12 years. They have a better life quality, they have an improved nutrition, the families are very happy and satisfied, and they had no reason for discontinuation. Of course, we'd love to do what the guides say, and we'd love to have expertise and to be able to also support non-eligible patients.
Adaptate fiecărei nevoi, să menținem legături cu pneumologi, cu medicii de medicină primară și cu celelalte specialități, dar cred că sunt
I think that unfortunately it's very difficult to have consultations, assessment adapted to each patient's need, but we need to adapt to the growing needs of patients who become adults.
Mai mulți membri în echipă, facilități mai bune, centre cu adevărat structurate ca.
We need centers who are very well organized and also to include transplant, and we need more and more education for adults. I apologize for coughing so much, and thank you. We continue with the presentations of CF centers in Romania, and now I would like to invite to the floor Simona Mosescu from
Treptat vom recupera pe parcurs, chiar dacă avem o ușoară întârziere.
Bucharest. We are slightly late. Our flight has been delayed.
Singura diferență e că avem mai mult loc la picioare.
But we have more leg room than in an airplane, so even if we are delayed, we are at least sitting comfortably.
Am să prezint situația Centrului de Fibroză Chistică de la Spitalul Gora Vesta.
I will talk about the situation of cystic fibrosis at the regional Center, Clinical Children's Hospital Grigore Alexandrescu. The center was set up in 2002. In 2006, it became a regional center, and it became part of the patient registry in 2011 when we had 31 patients. Overall, we've diagnosed and treated 29 patients ever since. And we are following 50 patients now. We're monitoring 50 of them. Several of them with ileus meconial. Unfortunately, we had 3 deaths for those under 18. In 2024, we had 2 new cases. When it comes to Pseudomonas, intermittent or chronic Pseudomonas infections, roughly 20% or higher, but at least for 5% of the cases, it's a Pseudomonas infection. The mutations we have seen 22 children homozygous with delta F508. And we have 9 patients with different mutations of delta F508. Both mutations are known. This helped. What helped in sequencing were Professor Maciek from Prague and a grant from ECFS from Belgium that helped with 8 of the sequencings. So 29 patients on CFTR modulators. The CF team within Pediatrics 1 is made up of 2 specialized pediatrics. One is specialized in pediatric pneumology and one is specializing in pneumology. We have a physiokinetotherapy service of the hospital with physicians that ensure physiotherapy, respiratory physiotherapy of our patients as well. We have CIMEOX for those who are admitted to the clinic, and they benefit from it all throughout their admission. We have a PAP mask, and the physiotherapy takes place in the ward where the patient is admitted. We have a dedicated psychologist for CF, and we have 2 nurses who help with programming the checks. We have 1 ward allotted for 1 patient per patient with CF. They came to us for exacerbations or for trimestral antibiotic treatment, for those who have an advanced pulmonary disease, for dehydrations and subocclusive syndromes. These are the main causes for admission. We can admit other patients as well, but unfortunately they cannot be isolated. They are in the same ward as other patients, but never 2 CF patients in the same ward. We have a subcutaneous patients. We have diabetes mellitus patient. We have a portal hypertension patient. We have occlusive syndrome, distal intestinal occlusion patient, in fact, and rarely recurring pancreatitis. We have a Facebook page as well, dedicated to educating the parents of the patients. This is an idea that occurred to us after we started collaborating with the Leuven Center in Belgium. We've had this collaboration with them since 2021 within the Twinning project. We received 2 grants, a grant from ECFS in 2022-2023. We used the funds for a software dedicated strictly to CF patients. The admission is 14 days for antibiotics, antibiotic treatments. We do physiotherapy as well, I'm talking about those who have severe respiratory infections, whether intermittent or chronic. They can come to us if they have exacerbations. We establish the recommendations. We have annual evaluation, pancreatitis. For those who need supplements in case of malnutrition, we have various investigations, endoscopy, tomography, MRI, fibroscheme, and so on and so forth. We carry out biochemical evaluations as well, and ultrasounds. And for those who have cirrhosis, annual fibroscan, and yearly or every 2 years, depending on patient, an abdominal CT or an abdominal MRI. When it comes to outpatients, patients are clinically assessed and microbiologically assessed. We use the laryngoscope and try to get a sample, a deeper secretion sample. We carry out spirometry, the history of nutrition. We don't have a nutritionist, so we do it ourselves. We're interested in the diet, the kind of vitamins that are taken and when. We check for treatment compliance, whether the medication was administered and how correctly. We correct and reassess physiotherapy. We have a physiotherapist with us at the annual check. We carry out an annual psychological evaluation. We have a social assistant as well, a social worker. Lab exams are carried out every 3 months. In the first year of modulators, we usually do these exams once a year. And generally, the patients are examined every trimester. Based on the assessment, we make the recommendations or we draw up a new investigation program. 1, maximum 2 patients are scheduled per day, and we have a CF protocol within the hospital. Collaboration-wise, we collaborate with the whole hospital, from pediatric surgery, that gives us the cases, but also helps us, supports us. Gastroenterology, pediatric hepatology, imagistics, bronchoscopy, ENT, lab, pharmacy, genetics, and so on and so forth. We carry out the first genetic determination. 48 mutations are sent to the Center for the Protection of the Mother and Child, and then we send them out for further sequencing if the outcome is not satisfactory. Here is the data I took from the European Registry for 2023. They only refer to our center. This is divided by gender. We have slightly more women, 54%. The age when the diagnosis is made. The mean age, 50% of them are diagnosed at 0.3 years, and the mean age of diagnosis is 1.3 years old. The age of our present cohort, the mean age is 10 years, roughly 10 years.
Din punct de vedere al valorilor VEMS-urilor, între 6 și 11 ani
Between 6 and 10 years, we have a mean of over 100%.
Din punct de vedere al Z-score pentru BMI, la copilul 2-5 ani avem o medie de minus 0,7, la 17 ani minus 0,2,
12-17 years minus 0.3%. When it comes to infections with Pseudomonas, on the right side, is the slide from 2021. The positive patients are in red, and on the left side is 2023. Here we can see that the incidence of Pseudomonas has decreased as resulting from microbiology tests. But as we know, Pseudomonas cannot be, we cannot be sure that Pseudomonas is completely absent. We don't have the possibility to carry out more complex tests. So we have very few patients with Pseudomonas infections, 5% of them. We're not quite sure if that is the correct percentage, but for sure the cases have decreased. We recommend this to all our patients. The inhalated anti-Pseudomonas antibiotics treatment, 60% of them still take it. And the microbiology exam, we're not really sure that Pseudomonas is completely gone because we just have a secretion through the cough swab. But we maintain the inhalated antibiotic. For diabetes, we have 2 cases, and liver disease is the most frequent complication in our cohort. 19% of them have it. 2 have cirrhosis, 1 has portal cirrhosis. We used modulators for the cirrhosis patients as well, but they're at the beginning of the treatment in their first 6 months. We will monitor them. The liver function hasn't deteriorated so far. Thank you.
De la Spitalul de Urgență pentru Copii Marie Curie din București.
The Marie Curie Emergency Hospital for Children in Bucharest, Maria Iulia Bustan and Raluca Marianechi, for please welcome them. Hello and welcome for inviting me.
I will try to speak in English. I'm a little bit nervous. I'm not that experienced as my previous colleagues are. So we at Marie Curie we have patients from the southeastern part of the country. So we have 24 patients from Bucharest, and the rest of our patients come from different counties in the southeastern part of the country. In 2023, it was the first year when we managed to enroll all our patients in the ACFS tracker. Until then, we only managed to enroll a part of our patients. In 2024, 2 patients were lost in follow-up. We had 4 new diagnosed patients. 1 came from neonatal screening, and 3 patients came from our neonatal intensive care unit. And I think it's very important to mention that these patients from the neonatal intensive care unit are missed on neonatal screening because they are born with different problems and they are transferred from the maternities where they were born, so they miss the screening. So it's very important to do something maybe in these cases. So now we have 57 patients, and 22 of them are adults. So we still see them in their adult life. Regarding the genetic variants, we have 26 homozygous patients, 26 heterozygous patients, and 5 patients that don't have any 508 delta mutation. I used the CFTR2 for. This is the list of non-homozygous genetic variants, and I used the legacy name, but there are 2 variants that I did not find in the CFTR2 database. So according to age, according to genetic variants and patient consent, we have 39 patients in treatment with Kaftrio, 7 patients that are still being treated with Orkambi, 5 patients that are eligible but waiting for treatment according to current Romanian protocols. The 5 patients that don't have modulator treatment according to genetic variants, and 1 adult patient that refused to receive treatment. Regarding the outcome, we can definitely say that situation has changed. So my experience in working with CF patients started in 2010, and the situation was very different. So when I first started seeing patients with this disease, so I can say that we see happier patients and happier families, so situation is definitely changed. I only have the data from the SCFF tracker, so I don't have the data before that. So I can say that the sweat test is really reflecting the treatment outcome. So what we have and what we don't have. The list of what we don't have is unfortunately bigger, but I will start with what we have. We have a multidisciplinary team, even though maybe as Dr. Drecea said, we don't have trained people, but they have experience because they worked with CF patients a lot. So we have pneumology, we have an experienced pneumology doctor that we can address special problems. We only have 1 physiotherapist. She started this year, but she is very eager to do a lot of things for she's dedicated for the CF patients. We have gastroenterology and endoscopy. We have ENT, and they also help us with bronchoscopy and bronchoalveolar lavage. We have a radiology team, and our colleagues are very helpful in helping us with non-invasive measures to monitor CF patients. We have diabetology, we have a pediatric intensive care unit and neonatal intensive care unit, and also pediatric surgery. After the pandemics, some good things happened in our hospital. So this is part of the 7th floor in Marie Curie Hospital. So me and my colleague, we work on the pediatric ward that takes cases of infants 0 to 3 months. So when we start cystic fibrosis, we start them young, and after that we see them through adult life. And after the pandemic, we managed to make a separate entrance for the outpatients also. So the circled area has only 2 rooms for the outpatients, but we try to keep them separate according to colonization. That is where we do the lung function testing, the sweat tests, and also the physiotherapy. We just started with the physiotherapy. We have more to do, but we have a lot of faith in our new colleague. We use macrodochlorocheck chloridometer. We performed 136 sweat tests this year. We mainly use Spirolab for spirometry. We like it better. In December 2022, we managed to get, it was a sponsorization from some friends in the Chamber of Public Notaries in Bucharest, gave us this, so the funding for the Inocoril CI. We used it for all our patients that are older than 6 years, and we recently started trying to do it in younger children. So we have the 10 kilograms plus soft. So this is what we try to do this year. For physiotherapy, we use Simeox. We have 3 Simeox devices that we don't only use in the hospital, because lately cystic fibrosis patients don't come in the hospital because of their very good outcome. Maybe 1 or 2 patients are admitted in the hospital, but we also give them to the patients to take home and bring back. We don't really use the cuff assist anymore because they don't like it. We used it a lot for severe patients in the intensive care unit, but we don't have patients that are that severely affected. So what we don't have, we know what we don't have. First of all, we don't have sustained physiotherapy. A lot of our patients do physiotherapy on their own. We still don't have the means to do the physiotherapy in the hospital. Our colleague that just started this year tries to send them movies and materials and teach them. We're looking for solutions to fix this, because I think that now in the modulator area, physiotherapy is the main part of keeping them healthy, because a lot of the CF patients maybe gave up physiotherapy, and I think they should, adult patients with bronchiectasis and with severe lung, they should maintain their daily physiotherapy sessions. We don't have a genetician, we don't have a psychologist, we don't have genetic testing, so we performed the first test in our hospital, in our laboratory for the 31 gene mutation. We sometimes ask for help in Dr. Justira Stan for the 41 or 48 gene mutation, but for CFTR gene sequencing, we don't have funding. And also, we don't have enough funds to sustain all equipment, medication, dietary supplements. So we do this through private funding, and it's not sustained. And we don't have time, because no one in Romania has a designated center only for CF patients. So we keep in touch with all our 57 patients. Maybe they don't have the care that they would have in a big center, in a CF center in a more developed country, but they have our personal phone numbers. We keep in touch. We promise to be by their side, so even on weekends and even after we are, after they turn 18. Thank you very much.
Întrebarea mea este dacă reprezentați echipa spitalului împreună cu colega noastră sau invităm și pe dumnei. Prezentarea a fost pentru amândouă.
Thank you for your intervention. Moving on, we invite Mrs. Cristina Andrei, who will be speaking about the CF Center in Constanța. I want to remind you that in your files you have a survey, you have a questionnaire that we ask you to please fill in and to leave them with the receptionist because you can be part of the raffle. Hello, I am happy to be here today with you. I would like to thank the organizers for inviting me. I am coordinating the CF Center for a couple of years. I had a break during my maternity leave, but since 2018 I've been there uninterruptedly. We cover Constanța, Tulcea and Galați, but for the moment we have no patient coming from Galați. Basically we are a pediatric section with 16 patients. We try to isolate our patients in wards with their own toilet and bathroom. We have a diabetes doctor, psychologist. They don't deal only with CF patients, but also with the other patients, but I do want to thank them for their daily support. In our center, we have 16 patients currently. Their age is 7.3 years, the median age. The youngest is 1 year and 10 months, and he was diagnosed through neonatal screening. And the oldest patient is 18 years old and 5 months. The distribution of patients according to age at diagnosis, most of them were diagnosed as newborns, median age at diagnosis being 10 months. And but we also had a patient who was diagnosed when he was 3 and another patient diagnosed at 8. We have a predominance of male patients and urban, in the urban area. The sweat test is done with Sanasol SM1 analyzer that we have in our unit since 2011. The sweat test is between 100 and 120 millimoles per liter, and 5 patients have a value above 120. Regarding the genetic mutation, we have a homozygous delta F508, but we also have 3 patients who are heterozygous. For 3 of them, we had a complete sequencing, which was done at Sinevo lab, and it was paid by the parents twice. And the third case, it was paid through the help of a foundation. We also identify a polymorphism of the gene CFTR, and we do this in the lab of the hospital.
În ceea ce privește insuficiența pancreatică, ea predomină, fiind întâlnită la 13.
The pancreatic elastase is predominant for 13 patients. We have 9 patients with modulator treatment, 6 for Kaftrio, 3 Orkambi. There were also patients that switched from Orkambi to Kaftrio, and we also had a patient who was non-compliant and the parents interrupted the treatment. After the modulator treatment, the situation of the patients improved. By performing the sweat test, we realized that the values improved.
3 dintre pacienți au
3 patients already have 1 year of treatment, and 3 others will perform the sweat test when they turn 1 year old. No, when they have finished 1 year of treatment. The value of the sweat test improved even after less than 1 year of treatment with Caftrium. The score for weight, you can see it here, and the score for height. The Z-score for BMI is also present here, and you can see that the value decreased when the patient aged, maybe also because they received the modulator treatment when they were a bit older. Regarding the spirometry, you can see the improvement for 3 patients and the stagnation for 3 others. After the introduction of modulator treatment, pulmonary exacerbation decreased. We have a patient per each lot which presented exacerbations comparing to other years. We have patients who have Staphylococcus aureus. We have also 1 patient with Pseudomonas aeruginosa who also has Candida albicans. For other patients, we had rarely such germs. Regarding the complications, we can see you can see here pancreatic insufficiency and malnutrition, and also respiratory diseases. We also have cystic fibrosis related diabetes for 1 case, and 2 of them also have poor glucose tolerance, and 1 of them also had allergic bronchopulmonary aspergillosis. We also have other related diseases. We have a case heterozygous delta F5008 and 1087G larger than T, presenting an IgA deficiency. The second mutation was identified by sequencing. We also have a protein cow's milk allergy. We have a patient with also a delay in language development. To conclude, CFTR modulator therapy has a significant positive impact on a nutritional status. During the modulator treatment, there were no adverse reactions. We noticed a decrease in the number of respiratory exacerbations. We also saw a reduction of sputum production, and This considerably improved the quality of life and the number of hospital admissions. But with increasing age, we see that the weight was more affected than height, and the BMI also decreased with age. We had a patient who was diagnosed by neonatal screening, and we have completed sequencing in 3 patients. Some of our patients show low compliance with physiotherapy and inhalation therapy. One of them stopped the inhalation therapy against medical advice. Thank you.
Mulțumim și continuăm sesiunea de prezentare.
Thank you so much, and we continue by inviting Mrs. Dana Teodora Anton Păduraru, representing the CF Center in Iași.
Bună ziua! Mulțumesc și eu organizatorilor pentru invitație. Centrul regional Iași a fost înființat în anul 2006, la fel ca și celelalte centre regionale, și este situat în cadrul...
Just like the other regional centers, and it is part of St. Mary Hospital, Emergency Hospital for Children in Iași. As you can see, 6 counties in the northeastern part of Romania pertain to it. But we also had patients from other counties in Romania, such as Galați and Vrancea. If the families want their child to be treated and monitored by us, at the end of 2023, we had 80 patients under the age of 18. They're all monitored in 2 pediatrics clinics. Since September 2024, they're also part of the gastroenterological clinic. In 2023, we transferred them to the adult section, to the pneumology hospital in Iași. 4 patients were transferred who turned 18. And throughout 2024, other 5 patients were transferred there. This year, we had a death of a small child who was 1 year and 11 months old, who had malnutrition, had Pseudomonas infection, and had several previous exacerbations. When it comes to newborn screening, it was introduced at the regional center in Iași in July 2022. Then in 2023, we tested over 25,000 newborn babies from 23 maternity hospitals, 2 of them being private. However, not all these children that were tested, not all the tests were processed, in fact, because for 2 months we didn't have the necessary reactives to process the tests. 111 tests were positive. Eventually, we had 2 confirmed patients. Over the past 9 months, we tested over 14,000. 44 tests were positive. 4 cases were then confirmed. The screening is carried out during the 3rd and 5th day of life. The tests are sent to the hospital in Iași, where they are processed through fluorometry. When it comes to diagnosis, we carried out the iontophoresis by the end of September of 2024. Right now, we cannot carry out the sweat test because pilocarpine is no longer produced. Last year, the European Cystic Fibrosis Society wanted to donate a macroduct device to the regional center in Iași. The donation was refused by the direction of the hospital, because they said one of the pieces of the device had been repaired. Through the genetic center in the hospital, in the children's hospital, we can carry out testing for the most frequent 38 mutations. But this testing is done intermittently because we depend on the budget allotted to the gene program. The coordinator of the program says that the funds are not always enough. If the testing is done, the communication of results is done with a delay of 2 or 3 months, because there's just one geneticist who knows how to process the tests, the samples. Sequencing DNA, this can only be done if paid for, because this is very expensive. Not too many families afford it. Within the hospital, we can do other tests, microbiologic tests, the antibiogram, where we identify various germs. We can do pancreatic elastase tests. And generally, there haven't been problems when it comes to these kind of tests. When it comes to vitamin D dosage, this can be dosed either through the budget from the budget of another health national program or the budget of the hospital. We can also do some ultrasound radiographies, CT scans and spirometry, thanks to the donation from the European Cystic Fibrosis Society. When it comes to treatment, we know the recommendation of the guidelines of the European Society, and we try to apply them as best we can. Our patients receive enzymatic substitution treatment with Creon, but over the past few months, some pharmacies in the adjacent counties didn't have this available. The patients also receive aerosols with a hypertonic saline solution and a hypercalorie and hyperproteic diet according to the guidelines, supplemented by liposoluble vitamins, and in the case of malnutrition and weight hypertrophy, we also recommend various supplements according to the budget, of course. But I will go into more details about nutrition in the presentation on Saturday. We have kinetotherapists who can carry out kinetotherapy during the hospitalization of the patient, but these kinetotherapists are not specialized in CF patients. They know a few drainage and tapping techniques, and they try to apply them as best they can. Patients with various infections, such as Pseudomonas aeruginosa or Staphylococcus, get antibiotherapy. They're also isolated in separate wards. We don't have a special department for them, but we never have 2 CF patients in the same ward, or a CF patient and someone who has other acute conditions. Some patients have various complications, such as diabetes in the case of CF. In their case, we collaborate with a diabetes expert of the hospital in applying insulin therapy. We've also had patients with liver diseases who got the relevant treatment. Through the national program for treating CF, we managed to ensure the requested nutritional supplements and all the medication throughout hospitalization. The budget, however, is not always the one we ask for at the beginning of each year. However, through various substantiated notes we send, we managed to get all the budget we need. The main problem is, however, that we only get the supplements at the end of the year, so we no longer have the time to buy the products. 30 of the patients found in the registry of our Iași Center are in therapy with various CFTR modulators. The modulators were introduced in 2022. Most of the patients follow triple therapy. 22 of the patients, well, in fact, one of the patients was moved from was moved to triple therapy after 1 year because his evolution was not favorable. We didn't really get enough improvement in the respiratory parameters or in weight gain. In general, modulated treatment has been well tolerated by the patients. There is only one patient who had side effects. We needed to stop the treatment in his case because the transaminase values were 3 times over the normal value, and bilirubin was twice over the normal value as well. Over the past 15 years, when I've been the coordinator of the CF program in children, I try to put together a multidisciplinary team. We are 7 pediatrics involved in the diagnosis, monitoring and treatment of these patients. We collaborate with pediatric pneumologists and with the infectionist physician at St. Mary Hospital in Iași. We have gastroenterologists and endocrinologists, ENT experts, gene doctors, a psychologist and a psychiatrist, but these are not specialized in CF patients and their families. We have a kinesiotherapist as well, but these kinesiotherapists are not specialized in CF. We have pediatric surgeons and anestheticians as well. We don't have a nutritionist, so we pediatricians try to do what a nutritionist should do. I've also studied nutrition and dietetics, and I try to put in practice all the knowledge that I gained. When it comes to communication with patients with CF and their families, it's easier to communicate with some of the patients. Some are compliant to treatment, some are less compliant. They do not observe the treatment, and they do not come for checkups regularly. We also try to have good communication with family doctors who have a registry of CF patients. I personally have tried to organize post-university studies and courses for these family doctors, but the adherence was not as expected. Thank you.
Despre situația centrului de tratare din Cluj-Napoca ne va vorbi pentru început doamna Cila Enicosabo.
We'll have Mrs. Cila Enicosabo here and Mrs. Monica Pop and Victoria Ruța. They will talk to us about the center in Cluj. Hello, I would like to talk about the situation at the regional center in Cluj-Napoca. You learned about the beginnings. I will not say them again. Through the order of the Minister of Health in 2006, this center was set up. The regional center in Cluj-Napoca caters to 7 counties: Cluj, Alba, Sălaș, Bistrița, Năsăud, Satu Mare, Maramureș and Sibiu. This center is part of the pediatrics clinic #1 in Cluj-Napoca. We have roughly 30 children with CF. Among these, 5 have been transferred to other centers. We have roughly 3 new cases every year, and we transfer 1-2 cases to adult care per year. How is the center organized? Unfortunately, we have very few dedicated beds for cystic fibrosis patients. Equipment-wise, we have sweat tests, spirometry, nutritionists, and we can carry out lab assessments and imagery tests. Unfortunately, we have no physiotherapist for CF. This is what our wards look like. We have a special ward dedicated to CF patients and a second ward in case of need. At the beginning, we used these first devices, but now we have a Savisol device and a sweat ChloroCheck device, which we got as a donation from the European Registry for Cystic Fibrosis. We used to have a Faber spirometry device, but now we use a BTL Spiro. You can see them all in these images. One of them was given to us as a donation from the Romanian European Registry, and we use this for CF patients. Gene testing. We usually carry out testing for the most frequent mutations in our lab. We test the Delta F508 mutation, but it's now discontinued because our genetic testing specialist is on maternal leave. We identified 68 mutations at another lab in Cluj, and in well-selected cases we managed to obtain sequencing as well. What is our relationship with our patients and with our colleagues? We have a good relationship with our patients and their next of kin. We try to keep in touch over the phone and through personal meetings whenever needed. We have no major problems in regional hospitals. The patients can be seen there as well. The connection with physicians in the regional hospitals is good. Transfer to the adult section is done smoothly. We have a good relationship with the pneumologists, for adult pneumologists.
Regarding the difficulties and challenges that we face, we don't have a physiotherapist, but we are hopeful for the near future. We also are not able to perform osteodensimometry. Most of our patients are from Cluj, and a slight predominance by male. You see here the patients' genotypes for those who are under 18. And with the help of Professor Macek, we did the sequencing, and he promised to continue to help us. Out of our patients, we have a pulmonary colonization with Pseudomonas. 15 patients benefit of modulator therapy with Orkambi. We have our patients in the European registry. We started in 2017 where we reported 16 patients. With time, this number increased, and we included 21 in 2018, and in 2023, 29 patients were inscribed. Thank you so much.
Dăm la pupitru pe doamna profesor Monica Pop.
And now we invite Monica Pop to speak still about the situation in Cluj-Napoca. Hello, and thank you for giving me the opportunity to speak to you about cystic fibrosis in adults, because more often than not we speak about the pediatricians who help with the diagnosis, the care, but now I want to focus on the adults. Oh, I have a lot of slides with theory, but I will move fastly through them because I suppose that you are aware of most of the information here, the symptoms, the diagnosis. But what we want to do is to provide the management of the patients. For example, measures regarding their hygiene, their diet, the treatment of the disease that caused and maintains the bronchiectasis, the treatment of ciliary clearance, the drainage of secretions, the treatment and management of infections, of bronchic obstructions, surgical treatment, and management of complications. Here you have a list of all the objectives of the treatment. We insist on the drainage of secretions, of course, through physiotherapy, tapping, etc. We also need to speak about the treatment of ciliary clearance. We also need to speak about the therapy and the treatment of infections, because more often than not we have germs such as Staphylococcus, Streptococcus, and Pseudomonas. Antibiotics need to be adapted, of course, because we cannot just apply antibiotics like for any other patient. Here you see the table with the main antibiotics recommended for our patients. Of course, the surgical treatment also needs to be customized, and we need to take into consideration the specificities also for artery emboli and, of course, for lung transplantation, which can represent an option for treatment. In Romania, for the moment, this is not possible, but in the near future, it might be an option. Palliative care, but also new treatments such as modulator treatment. Our patients come from the pediatric section, as I said, and they also have a very complete file with the gene analysis, etc. We have several patients carriers of the gene 508 homo or heterozygotes. We have a patient who's 27 years old, who's been just diagnosed. He's from Alba region, and with my colleague, Dr. Sobo, we did all the necessary tests. We initiated the treatment, and he's in the second month of treatment and is doing quite well. We have another patient, Solomon. He is from Sibiu region. He was treated in Germany, and we continue the treatment that he started in Germany. So we have these patients that have a specific and also supplementary treatment. We also have these other patients without the gene 508, and they only undergo the basic treatment. We have the possibility to carry out biological treatment, spirometry, kinesiotherapy, and the genetic treatment is free of charge only for children or for minors, for underage, people under 18. So we must pay for genetic tests for adults. The patients that I showed have a good outcome. We have a good spirometry. The sweat test also is with good results. So we are quite satisfied. Thank you for your attention. Thank you, Professor Monica Pop. We will try to forget the names in case of GDPR infringement. But let's talk still about adults, patient, and we have the intervention of Dr. Victoria Ruță. Thank you so much. As we've seen today, CF needs more and more trained doctors. I loved the idea of Professor Pop saying that we all need to be aware of this disease. It can't be underdiagnosed anymore. I know that we need a lot of specialization. I will be speaking under the perspective of lung specialist, but also medical recovery. I trained to become a recovery doctor. As we've mentioned, this disease becomes the disease of an adult, a chronic disease of adulthood. The patients are able to survive for many years, but it's more and more complicated. It is sad, but it is true that we meet most children in the emergency unit when there are exacerbations, and you see all of these cases, and we were used to children, but now we all need to be focused also on the care of adults. We need to focus on several specificities. These are young people who go to school, who go traveling. We also have a lot of immigrants. So we need to take all of these into consideration. We need center for CF care, but the new therapies need also to be included. And yes, respiratory recovery is extremely important. And this respiratory rehabilitation is very well known by parents. In one case, I asked for the advice of the parent because the parents sometimes know more than the doctors, which are not specialized. But kinesiotherapy is not enough. Of course, we need to adapt it from case to case, and also we need to focus on aerobics. Let's not forget that kinesiologists are not focusing on this specificity in the medicine of the future. We need to have a focus on airway clearance techniques. We need to encourage the children to play sports and to be active, but they need to have more than this. This is not equivalent to rehabilitation. They need to focus on aerobic exercise. Aerobic exercise means that they perform these exercises for at least 10 minutes that cause the heart rate and ventilation to increase. They also need to have muscle tonification and other targets. We need to start this rehabilitation as early as possible, even from beginning with the childhood. They all do tapping at home, yes, but in order to prevent exacerbation and the degradation of the lung function, you need to do everything from in the hospital, but also outside of the hospital. Exercise airflows may not sufficiently move secretions, and during hospitalization or up to 4 weeks after discharge, they need to continue these techniques. Unfortunately, in Romania, life expectancy is still very low. In Cluj, we have received the approval for changing the organigram of the hospital, and we also have this respiratory rehabilitation that is included in our center. But let's not forget that these treatments need to be customized. Unfortunately, out of the adults that are part of our program, we have not even one adult that took part in such a program. We have a process of transferring the healthcare of CF patients between teams, and we need to move them from pediatric centers to adults, and we need to do it in a way in which they accept it easily. The transition process should occur between the ages of 16 and 18 in order to help them improve. You see, this is our small room. We are not very well equipped. It's just me and the kinesiotherapist. We do wish to have a bigger room, more equipment, and we need to find more solution and also to separate and isolate CF patients from other patients with respiratory issues. We have a rehabilitation site, we have lung specialist, we have a physiotherapist, we also have a psychologist, and we also have an intensive care unit. It's not about the place, it's about the people. This is our slogan. We wish to increase our capacity. We want to do more for our patients, but time will tell. Thank you.
În minutele următoare la
Up next, we'll listen to Professor Ioana Ciucă, who represents the center in Timișoara.
Hello.
Good evening, everyone. Thank you very much for inviting us here. And thank you for coming in such great numbers. In what follows, I will talk a bit about the center in Timișoara. We each choose to see in an image one particular thing. The image in the middle is an image of the windows to our center. To the left, we have an image, I think you have 65 roses here, right, in this wonderful bouquet. So, as pediatricians, we tend to see 65 roses here in this image, and not necessarily the disease that affects the lungs. There is no future or no present without the past. The center was set up a long time ago, in the 1960s. That's when the first sweat test was carried out by Professor Popa, and back then they used a rudimentary device. After that, Professor Popa had very high hopes concerning the early diagnosis of CF, so he tried in the 1960s to use this device. The incidence was of 1 to 100, a much bigger number than today. 2 years after the gene was discovered, due to a sort of twinning project at the time between the center in Romania and in Bucharest and the center in Timișoara, Professor Popa went to Manchester. He brought a few samples from there, and the first genetic test was carried out. At the time, the center was made up of various colleagues. You can see here in the picture. In 1997, the center was set up. Following this, the learning and awareness raising of cystic fibrosis knowledge. In 1997, because ever since then there's been an awareness of the fact that there is lagging behind in physiotherapy, so the first activity was to open an international course of physiotherapy for CF. And then the first national conference took place. And lately, we've started organizing CF events that include more specialized colleagues. Just a few historical historical information. In 2004, we published a handbook for parents then A national guideline was published by Professor Popa. Our colleague, Professor Tomasz Liviu, started developing genetic testing in 2005. And he started working on prenatal testing, prenatal diagnosis. And we were also part of an international project. But going back to the Cystic Fibrosis Center in Romania, in 1987, it was already important. Now it is led by Professor Popliviu, whom you've already listened to. Half of the treatment is carried out by physiotherapists. We are 2 pediatric pneumologists, and we also have 2 diabetologists. We also managed to find a nutritionist, luckily. The gastroenterology team is led by Professor Pop with 2 other female doctors. And when it comes to intensive care, Dr. Mihuț is the one who coordinates the more advanced cases. Fortunately, we haven't had too many problems lately. We have 57 patients. They come for assessment regularly. The controls, the checks are done every 3 months. Those who live in Timișoara or in the county come monthly. The meeting is an important moment because every time we meet the parents, we are able to discuss all the new problems. To make things easier for us, at the beginning of therapy and during the first sessions when we get to know each other, we give advice to parents of patients with CF. Yes, we do know that there are so many associations nowadays, and I would like to congratulate all the parents of children with CF and all the patients who've had an extremely important role in introducing new and modulate therapy in Romania. But it's also important for us to administer our patients therapy according to international guidelines. I didn't mention anything about therapy here on the slides because in Romania we tend to use the European standards for care. That's why our patients receive medication, not just modulators, but other kinds of therapies that must not be stopped in the case of CF patients. We also give guidelines and advice to our patients. And we also organize frequent Q&As. I think this is very important. We have spirometry. Like our colleagues, we also benefit from the ECFS registry grant, which has helped us greatly. Through that grant, we received the spirometry devices as well as a ChloroCheck for sweat test device. We have a growing team, and the pediatricians in the team learn how to work with the CF child patients. The pulmonary clearance index, we carry it out as well. What else? We carry out lung ultrasound. We use it as a screening method before the CT scan and the result of the CT scan. We carry out CT scans for advanced patients when needed, according to the guidelines, but we use lung ultrasound as a screening method from meeting to meeting in order to detect advanced pulmonary diseases. We obviously observe all the infection prevention methods. If there is considerable stability of the lung function and the patients do not have exacerbations, sometimes we delay carrying out the first CT scan up to 4 or 5 years. But for sure, there are clear indications for those that have a suspicious score. We also collaborate really well with our colleagues, radiologists from pneumology at the Victor Babeș Hospital. They can quantify the CT scans. In pre-intensive care, we can use non-invasive ventilation or increased oxygen flow therapies. We use Senasol, now we use Chlorocheck, and we have a very good microbiology lab of the county hospital, which we are part of. We have access within the hospital to elastography, and our colleagues from gastroenterology take care of that. When it comes to physiotherapy, Bogdan, our colleague, will have a presentation tomorrow. Thank you very much for listening. I don't think we should talk too much. I would like to thank you. Thank you for inviting me. And I would like to thank our little patients and their parents. Without them, we wouldn't be able to have this good evolution in them. And we know that together, even though we cannot hold hands, we know that together we can do more. I think this is extremely important. I would like to make the transition now to my colleague, Professor Pescaru, who will talk a bit about the Adult CF Center in Timișoara. Hello, and thank you very much for inviting me today. It is for the first time that I've participated in this conference. I would like to talk to you about the CF Center for Adults in Timișoara. It was set up following a minister ordinance in 2007. The first adult CF center in Timișoara was set up. The coordinating professor was Professor Oancea, and for 5 years I've been coordinator of this center. I also coordinate the Medical Respiratory Rehabilitation Center in Timișoara. I think this has helped me a lot to offer better care to CF patients and to better understand their needs. And I'm glad to have alongside me a multidisciplinary team. Together we help our patients get a better life quality. We want our patients to have a better quality of life, to have fewer exacerbations, to live longer and better lives. Through all our actions, we try to get these objectives, to attain them for our patients. We have an NT team, and we approach every case individually, from a pharmacological point of view and non-pharmacological point of view. We collaborate with the other specialties in order to manage the comorbidities of the patients. This helps us and the patients live better and longer lives. The transition from the pediatric center to the adult center is very important. Why is that? Because after perhaps 18 or 24 years of spending time in a pediatric center, it's very difficult for the children and for the parents to come to us. But because we have very good collaboration with Professor Ciucă and Professor Pop, due to the fact that we also meet face to face and talk about the patients, the trust of patients increases. I don't know what it's like in other adult centers, but in our case, the transition is quite smooth. And the mothers come with us trustingly. Because they trust us, our collaboration is very good. And the outcomes are very good for patients. It's important to make a transition and not just a transfer, and to know as much as possible about the patients. This is a transition sheet that is completed by our colleagues in the pediatric center. It helps us manage our patients. Luckily, I work in a big hospital in Timișoara, the clinical pneumology hospital in Timișoara. We have cutting-edge technology, and we are able to offer all the investigations that our patients need: biological testing, imagery, functional tests, and so on and so forth. If needs be, we carry out CT scans for the assessment of the situation of bronchiectasis. Over the past few years, the MRI assessment has been developed a lot because we don't want to irritate the patient. It is carried out with children patients and with adult patients. Ultrasounds are also something that can be used to monitor the evolution of these patients imagistically. The Functional Explorations Lab is cutting edge. We have pyrometry devices. We can use them for assessments, and we can detect the muscle force. The patient who goes into a rehabilitation program, a CF patient, has to be monitored in time. We're interested in patient's progress in time. So we determine all the capacities, and the lung capacity and respiratory capacity. So we know, following these tests, if the patient has done all the physiotherapy and whatnot. This is our team at the Functional Exploration Lab. In hospital, the patients have 2 separate wards with different separate circuits. Luckily, in the past 6 months, due to the MD team and the care, our patients had no exacerbations at all. So there was no need to admit them to hospital.
Este foarte clar tuturor că modulatorii au schimbat viața acestor pacienți.
It is very clear to us that this new center has changed the life of our patients. So I would like to thank Mihai and all those who were able to introduce modulators in Romania. But besides modulators, we also need the rehabilitation, they need the clearance techniques, they need the substitution, enzyme substitution care to control the infections, to treat the complications that they have, diabetes, hepatopathy, cirrhosis, etc.
Asigurăm o nutriție corespunzătoare acestor pacienți și vitaminoterapia sau bronhodilatatoarele. Datorită a tuturor acestor îngrijiri,
given all this care and all the benefits that we clearly observe by introducing the modulators, we also noticed, because we have 12 adult patients, we have noticed an improvement in their BMI, the decrease in the need of antibiotics, no exacerbations or reduced number of exacerbations, and a lower number of hospital admissions. You have here the SWOT analysis, the strong points, the weak points, opportunities and threats. And what I would like to underline is the modification brought by CFTR modulators. We've noticed that there are a lot of young people who want to learn about CF, so I'm positive that we will be able to have a continuation in this treatment. Among the weak points, I want to mention just a couple of them. Unfortunately, we don't have our own device for the sweat test. We don't have enough adult centers in Romania, and not all the centers have a multidisciplinary team. We in Timișoara, we have all the specialties that we need.
Iar testarea în laboratoarele private este destul de limitată, doar la 23-39 de alele și este posibil ca unii pacienți să nu identifice.
And we have only a limitation of commercial kits for genetic testing, and we don't cover all the alleles recommended.
Ca și amenințări sunt probabil lipsa de resurse, sunt diferite centre, chiar și la noi. Sunt anumite probleme financiare care pot să apară și să afecteze.
And we have the opportunities and the threats that you could see. This is the multidisciplinary team. This is me and my colleagues who treat patients. We also had a conference which was a hybrid, and it was both online and on site, which was dedicated to kinesiologists and we all focus on improving the quality of life of these patients. You see here also our physiotherapist, kinesiotherapist, they are very experienced in the rehabilitation of CF patients. And we also see here our specialists who help us in our day-to-day lives. Thank you to all the parents, patients, and I want to thank all of you who are dedicated and who are present here for this important event, because we need to collaborate. Thank you so much.
Nu înainte de a mulțumi doamnei doctor Camelia Pescaru pentru această prezentare, punem punct acestei sesiuni.
I want to thank you, and before moving to the Q&A session, we want to show you a video message on behalf of the government, which unfortunately cannot be translated. This is the message of a government advisor.
Salut organizarea lucrărilor conferinței sud-est europene de fibroză chistică cu participare remarcabilă atât la nivel național cât și internațional. Îmi exprim speranța că
I want to express my hope that all the topics that were debated now this is the opportunity for you to meet each other, to communicate with specialists, which is essential in this field. I'm also convinced that the efforts that you carry out will be shown with in the care of CF patients. CF is in need of continuous treatment. Continuous care is important, so it is also important for all decision makers and specialists, together with the patients and the caregivers, to collaborate and to find the best solutions to provide care for CF patients. These CF patients need multidisciplinary approach, but also social and economic support. The national program dedicated to this disease needs to be continuously improved and updated so that it responds to the needs of the families and of the patients. The patients need an integrated system and access to what they need. The Romanian government supports these efforts and wants to reduce the obstacles and the challenges for a better life of the patients and their caregivers. I want to thank you for this conference, and I want to guarantee that the Romanian government is your supporter, and I want to congratulate you.
Repetăm încă o dată titulatura consilier de stat la Cancelarea
So
primului
this
ministru, ca să
was
nu
the message of the advisor of the Prime Minister.
Întrebări și răspunsuri.
Okay, let's start with the Q&A. Please ask your questions in the microphone.
Unde se dorește să se răspundă, la fel ridicăm mâna.
Just raise your hands if you have questions so that we know who wants to ask the question. And hello, my name is Georgiana Nitsu, and I have a question for Professor Liviu Pop. Speaking about the importance of the register for patients, we know that a long time ago, we started the efforts for having a register in Romania. Is this still valid?
Nu. Nu mai este funcțional.
No, this register is no longer valid. Even back then, that register was done through our own efforts with the support of several sponsors and companies. It hasn't been functioning because there were these modifications regarding GDPR. At that time, the register was not done by respecting the GDPR, and in order to avoid all issues, we did not continue with it, and also it was not updated. But as I said, currently, any member of the Ministry of Health can consult the European register and can see whatever they need. I have a question about the centers in Romania. Do they all report to the European register? Yes, or at least they should. I'm not sure if they report all the cases, but I think that they do.
I can answer, I think, for 2023. 2 adult center and from Temeswar and from Bucharest stepped in, and also from Constanta, so the numbers is growing. We would like to invite also the adults from Iași and from Brașov and from Cluj, I think, to continue, and that would fit if all the patients send the informed consent. I heard from Iași that there's always a little bit of debate that not all patients trust in that construction, but I think the patient organization could support that as well. I think because on the European level you have less than 5% of patients who are not consenting, because this is pseudonymized, so there is no name in it. We could not contact anyone. So it's really, I think, GDPR compliant, and I think it should help you as a patient organization and caregivers to get to advocate, because I think, and I totally believe, it's underdiagnosed, I think, and there's a lot of to do also in adult diagnosis and in late diagnosis, as well in optimizing the newborn screening.
Thank you. So I would like to think all the presenters, showing us the situation in Romania, showing us the reality of the individual CF centers. So thank you for the openness, for showing us and sharing your barriers, the obstacles. I spotted that one of the centers is called National Reference Center, and that's Timișoara. So if I can ask for some clarification what this actually mean in practice, that you are the national reference compared to the other regional centers. So is there like any, potentially in that coordinating the other centers, sharing the care? And this is the follow-up question to from the previous session when we talk about the physiotherapy training, for instance. So is there anything like that Timișoara could actually organize this or, help the others?
Am să răspund în limba română.
I will reply to this question. The first endeavors for CF were made in Timișoara, and in Timișoara we started focusing on CF and solving some of the issues, and we were the ones to... So it was the first center, basically. So just because it was the oldest and the first, that's why it became the national center. At all the conferences and congresses and through leaflets even, we managed to raise the awareness and to share our experience with the colleagues who were willing to learn about this. We started with the medical information. Regarding the medical part, we have very good outcomes. But when we when we talk about physiotherapists, then it becomes complicated because it's difficult for our physiotherapist to move and to travel and to provide training because he is overburdened. He has a lot of work to do. It's also difficult for physiotherapists to come from other centers to Timișoara to be trained. But all in all, we try to improve this situation. Our main focus is to improve. Yes, we are open-minded and we are open to sharing our experience. I have another question because we mentioned the physiotherapy. It is well known that in Timișoara we have a very important center for rehabilitation, and I think that all the patients know the name of Bogdan. Bogdan is very well known and very appreciated, and my question is, do you think we can have some twinning projects between Timișoara and the other centers who complained that they don't have a trained or specialized physiotherapist? It can all start with a discussion. Just give us a call. Give us a call and we'll see. We can make things work.
The speakers, because it was a very nice overview. And now we understand the situation. I will talk about it tomorrow more in detail, but I wanted to thank Lutz in particular and ECFS that we can now continue fully sequencing, really free of charge for you from an ECFS grant. And we are open to receive the samples as before, and I want to tell you that sequencing is very important because the motto is not to leave anyone behind, and the rare mutations are ones which may be eligible for the so-called variant-specific therapies as well. So all those cases which you have, which were either tested for the 31 or 34, if I understood from your presentations, they can be sent to us if one or both are not identified. modified because you can have rare alleles. And secondly, those which were sequenced, as far as I understood, or were not fully sequenced, they can again come to us. And I just spoke to my colleague Malgorzata, you know her from communication. So far we did 286 Romanian samples, which I speak about samples, not about patients, really, because some of it was also testing the segregation of those alleles and so on. But roughly, it's, if I understood well, 45 to 50% of all your cases. So we can continue, and we will be more than happy to help. We still have some leftover money from the Vertex project, so you can start sending, and I will present my email again tomorrow. So we are looking forward to collaboration and happy to help. Yes.
Any other question? Alte întrebări? Ridicați o mână, raise a hand, please. Yes.
If I may, just a brief comment. In general, the knowledge about fibrosis and all the treatment conditions are not the worst they could be in Europe. There are, however, a few issues concerning the organization of the system, because that's the big hiccup. Getting back to that organizational chart by the Ministry of Health, I will give you an example at our center. As Professor Ciucă was saying, we somehow managed to hire a nutritionist lady who's very good, who did that 3-year university. But we lack the administrative terms to hire such people. So she's hired as a nurse. And we were unable to come up with any solution to sort this out. But this is one of the very weak points of the Romanian medical system. When it comes to chronic pathology, it's not just CF. The organizational chart is not updated to the current situation. We need psychologists, professional psychologists for acute situations, for chronic situations. We need physiotherapists for bones, for lungs. So these things could be resolved, could be sorted out, but I think we should pester the ministry more. It would have been better if this lady representative had been here. But anyway, that's the situation. There is a question at the back of the room. Good evening. I would also like to thank all the speakers present here today. I have 2 questions. One for Professor Simona Moșescu. I listened to your presentation very carefully and understand that often CF patients have other associated diseases. She spoke of cirrhosis and liver diseases. I would like to know what the main tests can be done or are recommended so that we know early on how we can identify these diseases. Well, the liver disease is usually associated with CF. Each patient is assessed yearly through ultrasound, abdominal ultrasound, and lab tests. And when there are any changes, that is the first alarm bell. Liver diseases come up around the age of 10, according to the evolution of the disease, to its severity. There are all sorts of tests, but they come gradually. We don't do them all of a sudden, all of them, for all the patients. So it depends on each case. Thank you. And one more question for Professor Victoria Ruța. I find that your work is essential in the quality of a CF patient. And I would like to know how we can implement this with children patients so early on, because you work with adults. But how could we train in order to do all those things early. Well, in Romania, it's very difficult to do that. Medical rehabilitation. In medical rehabilitation, we don't have respiratory rehabilitation in Romania. In order to be such a specialist, you need to do a second residency, medical residency. So I only work with adults because my patients are adults. For a child with CF, be able to go to respiratory rehabilitation, according to the current legislation in Romania, he should see to kinesiotherapists or to pediatricians who can further specialize to do this. Unfortunately, the pediatrics sections don't have medical recovery specialists, as far as I know. I'm not only talking about kinesiotherapists, because there are all sorts of patients with liver comorbidities and so on and so forth. So this is a separate specialization. We tried in Iași, Professor Postulache trains kinesiotherapists for respiratory recovery, and they tried to implement this degree for respiratory rehabilitation, but it's not possible. But everything is done according to age and the evolution of the patient. We don't do medical rehabilitation, general medical rehabilitation at 1, at the age of 4, and so on and so forth. Rehabilitation comes gradually and a bit later, but it's a great step forward, the fact that we have this for those who will be adults, and will have ever more adults with CF. Georgiana Nitiu has another question, but in the meantime I would like to particularly thank our interpreting team, because we've had such great translation. I would like to give them a round of applause. Adina, Roman and Maria Dan are our fellow interpreters. Thank you very much. Yes, I have a question for Dr. Moșescu. I heard something very interesting, namely that you're using surveillance software for CF patients, and I'm curious what it's about and if it helps you, if it can be implemented in other hospitals as well. Yeah, it's a software dedicated to CF patients. So every visit and every investigation is recorded there in the software. And that way we can find out everything, all the history of that patient. It's basically a database. It's very easily accessed. It also helps us send the data very easily to the patient registry. Of course it can be implemented, but it costs money. Good. Are there any other questions in the room?
Let's do it in auction. Facem ca la licitație. Odată.
Thank you. If I understood well, Professor Iulia Brustan from Marie Curie in Bucharest said that she takes the patient from the moment of diagnosis and monitors them all throughout their lives. Did I understand that correctly? Yes, you did. That is correct. We never forced the transition of the patients towards the adult section because, well, it wasn't our decision per se. It was just a natural decision following requirements from patients. The transition is not just for pneumology. Professor Cristi Popa helps us and particularly helps the patients because they need assessments for pneumology. But it's not just this particular thing, it's not just pneumology, it's about an MD approach. So the patients request to the ministry, and in fact, the physicians make a request to the ministry. This wasn't a decision as such. It just happened that way. The question is the request made by the patient, and he specifies where he wants to be treated? Yes, that's true. So the patient makes a request to the manager of the hospital where he or she wants to be treated, and then the request goes to the ministry. When the patient is 18 years old, he has to make the request. That is correct. The patient does that. As far as I know, adult patients can be treated up to 24, 26 in pediatric centers in the case of chronic patients. Am I correct? Is that not applied anymore? A great part of over 18-year-old patients are tried, but they are not admitted. I don't know if there's anything new. No, that's what's interesting, because at Marie Curie Center that is possible. So I was curious about their procedure. Well, they need an alternative before we refuse them. We can refuse them. We need to refer them somewhere. They need to be able to go somewhere. Before me, Dr. Stanciu cared for these patients ever since they were little children. Yes, but I think you need some kind of legal framework in order to care for these patients, and the National Insurance House is responsible for that legal framework, and their answer is no. By the time they're 18, they need to find somewhere else to go. What if a complication appears in the case of adults, for instance? Where do you take that patient? We take them to another hospital in Bucharest. The adults are admitted in hospital. We have a 28-year-old, for instance, admitted in the pediatrics section. Yes, it's a major problem. Are there any other questions? I'm curious if there are other pediatric centers that see adults. In outpatient, we see patients of up to 24 years old. If they're students, that's what the legislation says, but only in outpatient care. But we never keep the patient. Of course, we keep in touch with them. They invite us to their weddings, for instance, and they keep talking to us about what happens in their life. We maintain a relationship with them, but I think we also need to go our separate ways as well. We operate within the county hospital, and I came across a problem. I studied adult pneumology, and I came across this problem when I had to give a patient a certificate that he needed. And the physicians in the evaluation commission did not agree with the certificate I wanted to give him. For certificates, I go to Professor Cristi Popa. The idea would be to have adult centers who are able to take these patients. I think it's the correct way.
nu doar pneumologie.
Un centru de adulți.
Yes, but a center, not just the pneumology section. Yes, that's right. We need a center for adults. And we need a pneumologist there who can cater to them.
Ok.
Nu este o întrebare țintită. Oricare medic prezent în sală, dacă poate să-mi dea un răspuns, în una din prezentări am
In one of
văzut
the
în cazul
presentations,
unei
I saw
atelectazii
that
pulmonare,
in the case of
este
a pulmonary
recomandat
atelectacy,
acel drenaj precoce. Aș
that
vrea să primesc o explicație
early
ce
drainage
înseamnă și cum
is
se poate implementa lucrul
recommended.
sau
What
în
does
ce
it
constă.
mean and how can it be implemented?
Dacă practic se blochează un dop de mucus într-o bronșioară, acela
if
trebuie
mucus
scos de
is
acolo.
blocked in a-
Înseamnă că nu mai intră
is
aer
blocked,
în capacica de plămân și trebuie drenat. Sunt
it needs to be
mijloace
drained.
de inhalatori, evident, folosite de
There are
drenaj,
inhaling
ce
and
chiar
drainage
bronhoscopie
methods,
trebuie
and
făcută,
bronchoscopy
pentru că
needs to be
altfel
carried
se
out
mai
as
poate
well,
recupera
because
bucata aceea de
otherwise
plămân, se transformă în
that
bronșii
bit
și
of lung
face așa
cannot
mare,
be recovered
acumulează mult
anymore.
mucus
It
care se
accumulates a
face
lot of mucus that will get infected.
De aceea trebuie făcută aerosoloterapia în continuare, chiar dacă
That's
luăm
why
ambulator.
aerosol therapy needs to be continued, even with aerosols, in order to fluidify the secretions.
Ok? Punem capăt sesiunii de Q&A. Mulțumim pentru toată implicarea și pentru toate răspunsurile. Și pentru
Okay,
toate
thank you.
întrebările
We
care
want to thank you for your questions
au avut de fiecare dată
and
răspuns.
for your
Și apoi
answers,
oamenii
of
să dăm
course.
niște distinții
And
oamenilor
now let's
din Limoges care
give
astăzi
some
au făcut
awards
parte din
to
conferință și care
the
ajută
wonderful people who
mereu
helped us
și diseminează
today.
informația prețioasă. Îi vom invita pe rând pe scenă, în aplauzele dumneavoastră, și vom începe cu doamna Camelia Pescaru. Între timp, vă reamintesc că în mapa conferinței aveți acel survey,
I remind you that you have the survey in the folder. If you fill in the survey, the questionnaire, you will be part of the raffle and might win an attendance ticket for Pristina conference next year.
În aplauzele dumneavoastră va primi această distincție domnul profesor dr. Liviu Pop. De asemenea, Herr Narlich Lutz. Is it correct? Did I pronounce? Okay. Thank you. I'm glad to. Și, bineînțeles, doamnei Catarina Stepanovca. Doamna Cristina Andrei este invitată să primească distincția în aplauzele dumneavoastră. O așteptăm și pe doamna Laura Larisa Dracea. Aceeași distincție este oferită doamnei Maria Iulia Brustan. De asemenea, avem un certificat de apreciere și pentru Raluca Maria Nechifor. Doamna Dana Teodora Anton Păduraru, reprezentând centrul de la Iași, este așteptată să primească acest certificat de apreciere. Și o așteptăm și pe doamna Maria Victoria Aruță. Nu știu dacă doamna profesor dr. Monica Pop mai este în sală, dacă nu, îi vom trimite această distincție. Și Oana, poți tu să faci fotografia și pentru dumneaei? Sau stau eu lângă tine și reglăm în Photoshop?
Oana, I can replace anybody who's missing and we'll change this in Photoshop later.
Profesor dr. Ioana Ciucă. Și am văzut acolo un certificat de apreciere și pentru Ana Voievod, organizatoarea acestei conferințe împreună cu Nichi. Le mulțumim foarte mult în numele tuturor. Și pentru că suntem la capitolul mulțumiri, vreau să mulțumesc sponsorilor, partenerilor. Este vorba despre Vertex,
all the sponsors and partners.
Sapaco 2000, Cystic Fibrosis Foundation, Duc Farm, rețele de farmacii și în mod special Elize, dacă bine înțeleg, care de fiecare dată este foarte inimoasă și ajută pe toți pacienții. Mulțumim Nutrigenetics, mulțumim de asemenea Boehringer Ingelheim, Mama Manu, NIM Global Logistic, Carpental, Daisler și Zan. Trebuie să mulțumim și primăriei și Consiliului Local Cluj-Napoca.
We also want to thank the City Hall and the local council, and we invite you to dinner in the next room. And if you want to discover more about our beautiful city, you are welcome to join us for dinner, and afterwards you can go take a walk in our beautiful city. I also want to mention the partners, I think.
Just one wish. We would like to ask our doctors from Romania to make a photo with Lutz and Pavel, Milan. Is it possible now? You all are here, please. Thank you.
Așadar, mulțumim partenerilor noștri Take One Studio,
Yes, and I would like to mention all our partners.
Asociația Mihăiță Bariz și CFTR România. Cum spuneam, vă așteptăm la cină.
And as mentioned, you are invited to dinner in the next room if you want to join us.
Bineînțeles, nu le putem interzice lucrul ăsta.
If you want to go for a walk, that's also okay, as you wish.
A doua zi a conferinței începe
And
mâine de la ora
tomorrow
9.
starts at 9.
Încă o dată mulțumim tuturor celor implicați în organizare, susținătorilor, speakerilor,
We also want to thank all the speakers, organizers, caregivers,
pacienților și tuturor celor
patients,
care au fost
parents, and all those who were involved in it.